All right, good morning, everybody. Good morning, members of the committee and members of the public and those that are joining us via Zoom. Welcome to House Labor, Health, and Social Services Committee. I will call the meeting to order, and Mr. Caldwell, if you call the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heft. Here. Representative McCann. Here. Representative Ottman.
Here.
Representative Stivar. Representative Wasserberger. Representative Yen. Chairman Rodriguez-Williams. We have a quorum.
Thank you, Mr. Caldwell. So, committee, I'll briefly go over our decorum rules for everybody joining us in the audience and online. A copy of these are held out front of our committee room. Those that plan on testifying, comments will be directed to the issue under discussion by the committee. Any distracting comments on unrelated side issues will be called out of order. Speakers, please avoid personal criticism, ridicule, or any name calling directed at anybody else in the meeting. This includes comments of a personal nature directed at other speakers, audience members, or members of the committee. For audience members, we expect you'll refrain from any behavior that disrupts the orderly conduct of our meeting. Specifically, the rules prohibit any speaking out loud when another person's talking, carrying on loud and distracting side conversations, any shouting, clapping, or booing in response to a speaker's comments. Our guidelines are very simple. We just ask that everybody conducts themselves in a civil and respectful manner at all times during the meeting. And just a friendly reminder, please turn your cell phones off, including members of our committee. And we will get started. So this morning we have 3 bills on the agenda. We've got 7. We'll start with Senate File 157. We'll move on to Senate File 175, and then we will hear Senate File 155. My hope is that since we've convened so early this morning, that we'll get through all the bills. Again, thank you for working with us and being here this early. But if need be, committee, we will meet upon adjournment. If we don't, as you know, tomorrow is the last day to get bills out of committee. And so this committee does not meet tomorrow. So today is the day. So I will place Senate File 157 on the table for the committee's consideration. The bill's titled Department of Family Services Confidentiality Amendments, and it is sponsored by Senator Olson. So good morning, Senator, if you'd come on up. Welcome.
Good morning, Madam Chairman, and if it would be okay with you, I would invite the Department of Family Services to come up. This really is a bill entirely about them, so I think that would be appropriate if you
Sure.
agree.
Yeah, absolutely. Come on up, Director.
And then what I'll do is I'll give kind of a high level and then walk you through the bill. It's pretty straightforward, but I will walk you through it and then certainly take any questions that you do have. So this bill, Senate File 157, Department of Family Services Confidentiality Amendments, started in the Mental Health and Vulnerable Adult Task Force, and it eventually became a joint judiciary bill. So this bill has been worked through the interim. What it does as a whole is it authorizes data sharing, and particularly data sharing between the Department of Family Services and whatever the necessary parties are called out in the bill. So that might be state agencies as an example, but it also could be contracted community providers. And so if a provider is trying to or is available to provide services to a person who is going through our system, it allows the Department of Family Services to share data with that contracted provider. And I'll talk more about that later, but that's just a high level. So currently, the problems that we're trying to fix are that the Department of Family Services cannot share information with, just for example, the Department of Health to support certain legislative mandates that we've put in place. So we've required reports, we've essentially required the data to be shared, but our statutes do not allow for it. And our statutes do not allow for DFS, like I said, to share information with contracted community providers for services in need. So what The reason why that's a problem is because it puts the burden entirely on the family to reach out to the contracted provider to request services when it could, based on a simple referral, but when it could be even easier for those individuals to receive services by the Department of Family Services having the ability to reach out to that contracted provider and say, hey, this family needs XYZ services, will you contact them? And if we were able to do that, we believe we would probably have significantly an increase in services, and we wouldn't have as many missed opportunities for early intervention with families and children in need. Another area that this bill tries to address is juvenile justice programs. So the Joint Judiciary Committee has required certain data be collected and reports be provided to it based on juvenile justice, based on juveniles in the justice system. And the Department of Family Services does not have the ability to collect and share that information without this bill. And something that's key with that, and a lot of this information that's being shared is de-identified data. So it's not going to, especially with the juvenile justice system, that the data that we're asking for as a legislature are overarching numbers of, how many kids in this program, or how many kids failed to complete this program, or how many total people are going through the justice system. Questions like that don't require personal information, so it's de-identified. It's not going to contain the name, social security, date of birth, things like that. I'll let the Department of Family Services talk more about this, but it's my understanding this bill provides for rulemaking. So it's my understanding that one of the most important rules that will be put in place is an opt-out provision. So family members or individuals subject to the data share would have the ability to opt out before their data was shared. And that's probably not true for the de-identified data, but for the example I gave you where a family member is being referred for services, they have the ability to opt out of that, so their information is never shared with the community provider. So I think that's important. That was a question we had on the House side and had some significant discussion about that, so I think that's important for you to know up front. So page 2 of the bill, Madam Chairman, establishes a statute 9-2-2104, and this is really the meat of the bill. And it says that the director shall review the effectiveness and impact of programs and services, which shall include sharing data to the extent permitted by federal law. And then here's for what: for the purposes of referrals, provision of services, and participation in bona fide research. So those are the 3 areas that I talked about in my introduction. If you turn to page 4 in the bill, you'll see the bottom of the page, the juvenile justice information share that I'm talking about. It says that the department, for purposes of sharing data for referrals, provision of services, and participation in bona fide research, so the same 3 reasons, may share the information. And then page 7, section 2 provides that rulemaking authority, so that's exactly what I was referencing earlier. And then section 3 is a reporting requirement. The Department of Family Services is going to be required to report to the Joint Judiciary Interim Committee. And this is important on data that is shared pursuant to this act and any safeguards that have been implemented to protect personal data not later than October 1st, 2025. So the Joint Judiciary Committee is attempting to put their thumb on this and keep their thumb on it. I know on the House side, we had a lot of questions about data. There was concern about data maybe being lost or breached. And I just, from a legislative standpoint, we're doing everything we can to keep our eye on it and keep our thumb on it and make sure that safeguards are being put in place. If there's additional things that are statutorily required, that would allow the Joint Judiciary Committee to obviously put in place any statutory safeguards that are necessary, but otherwise, obviously keeping our thumb on it. And that is the bill, Madam Chairman.
Thank you, Senator. Would you like to add anything, Director?
Thank you, Madam Chairwoman. My name is Corin Schmidt. I'm the Director of the Wyoming Department of Family Services and really appreciate the opportunity to talk to you a little bit more about this bill. Chairman Olson really did hit on some of the high points. I think from where we sit, something that I would like to explain a little bit more is the kinds of data. So there's 3 things that this bill allows the director to do, and that's to share information for purposes of referral. So that's the very specific example about a family perhaps that we get a call on. And we go out and visit the family, and there's not enough reason for us to get heavily involved. But what we can say is we have home visitation services that are available. We have other services that are available. Would you like to participate or have somebody talk to you about those services? Right now, it's very specific. It's a release for a very specific piece of information that we then have to collect all of the releases to turn around and say, we're going to call these service providers and they're going to call you. So there's some efficiency a little bit built into this as well. So we get one release and we say, okay, we are going to call the public health nurses, we're going to maybe call the early childhood development center, and we're going to ask them to reach out to you to be able to provide services, all of which are voluntary. There's nothing that's required, it's just voluntary connections. So that's information, and that's very minimal information. That's a name and a phone number. When we talk about the provision of services, that's a little bit different. Those are data sets. That's the information we are already collecting within our data and sharing that perhaps with the Department of Health. So the specific example there is we are currently working with the Department of Health, providing them with data that currently is legal, and that is on children who are in care, so families who are in care. Most of the families we work with are at home, so their children aren't in care, they're at home. We cannot share the data with them for those families that are at home. The reason why we want to do that is that they're looking at their data for the purposes of fraud detection and also duplicate billing. So without being able to share half of the data that we have available, then it's very difficult for them to have a complete picture so that they can look for duplicate billing by providers, or they can look at potential fraud. The last example around the research is really the de-identified data, as the senator was speaking. We were asked a few years ago by the Community College Commission if we would participate in their educational data set, their longitudinal education data set. Because we know from a child welfare perspective and a juvenile justice perspective that kids who are in our system have poor educational outcomes. But we can't tell you anything more than that. We do not collect, we do not analyze data, we do not share it for the purposes of understanding what educational and secondary certification programs or educational opportunities are our youth being able to participate in, and then how do they do? Do they end up getting certified? Do they end up? So it's a very limited data set. It's not everything that we have. It's not the whole case. It would be in this case an identification number like a Wiser ID, which is already collected, that connects that youth with other records. That information is then de-identified. Anything that's identifiable is deleted, and then they can look at that data and understand more about educational outcomes for those youth. So the protections, and we discussed this at length in all of the committee hearings through the Mental Health and Vulnerable Task Force and also at Joint Judiciary, about the protections that we think are important. One of the biggest protections written into this bill is around the rule promulgation. So the idea is not just to allow all of our data to be shared. The idea is there a specific purpose for sharing specific parts of the data that we may have? That will be defined in the rule promulgation process. We will be explicit in saying, this is the purpose for which we're sharing the data. Here are the specific data points we will share. Here's who we will share it in very limited ways, typically with Medicaid, that's one of the big ones, or maybe with another agency like the Department of Corrections. And then we will go through the promulgation process, which then means that you would see that information. You would know through that process what it is that we're proposing to do, what data elements we will be sharing, and how, if anything, any information will be disseminated as a result. So for example, if it's research and it's going to be a report, we will be able to tell you what that report will essentially contain. Not the outcomes, but certainly no identifiable information. If if representation in certain areas are small, we won't list communities. So that's what that rule promulgation process would allow for. And that's also a very good way for the public to participate, because those rules, any promulgated rules, go to the public for comment. So we would share that information. The public comment would have a period to be able to tell us what they think about that. And then in totality of the legislature's feedback, the public's feedback, and then of course the governor's feedback, we would make decisions as to whether or not we would continue. So it is a very public process. Our data, our confidentiality statutes are just very limited. We can't even really share de-identified data because of how it's written. They were written in the 70s. It didn't, when the legislation or the original statutes were created, it didn't understand that there was going to be opportunity to refer, to share information in a way that we could be more efficient and target the way that we spend our money a little bit more effectively. So Madam Chairwoman, I can certainly speak to any of the specific provisions in here. A lot of this information is just conforming. It gives the director that ability to make a decision on whether or not they want to even pursue a particular project. And then that language is repeated where we have confidentiality statutes throughout our agency.
Thank you, Director. Senator Olson, can you tell me, are the statutes silent on this, or do they specifically prohibit the sharing?
Let me look if there are, I don't remember if there are any repealers. There are no repealers, so I don't think there's any statute that specifically prohibits the sharing of data. Because my guess is we would be repealing it. Go ahead, if you, it's a notwithstanding.
Madam Chairwoman, the first example of the restrictiveness of our statutes shows up on page 2, line 20. And this is in 14-3214, which are our child welfare statutes. So this is specifically around abuse and neglect cases. All records concerning reports, so that's the minute we get a phone call, and investigations of child abuse or neglect are confidential. So at that point, the minute we get a report, that information is confidential. So another example of how restrictive this particular statute is if we get a report from a school, and that is the #1 reporter. So of all of the abuse and neglect reports we receive, the #1 reporter are schools. And we get a call from a school counselor, and the school counselor says, I'm concerned about this child for X, Y, and Z reasons. Well, we may, based on that report, tell the teacher or the reporter, this really doesn't rise to the level of our intervention. And then that reporter right then may or may not know, or would know then that we probably aren't going to take any steps. Sometimes, though, when we get a little bit more information, it rises to a level where we need to probably go visit the family. So we may go visit the family, and at that point, we say, this still doesn't rise to the level of abuse or neglect, but certainly this family could use some services. We cannot then return a call to that reporter to say, we visited the family, we offered services, and they have declined those services. We will no longer be stepping into that. And then at least the school knows that we did something. The school knows that services were offered. And then at that point, the school can decide whether or not they want to offer more referrals within their own system. But we don't have a feedback loop. We take the information and then we don't report it back to anybody. That's frustrating, and it's really missed opportunity because the school may have had or has services that they could offer, but they're assuming since they called DFS, that DFS is taking care of it, when in fact, we're not. So that's another example of how restrictive this particular statute is.
And Madam Chairman, I guess I shouldn't have
Senator.
skipped over these sections when I was presenting the bill, but, you know, page 3 and mostly page 3, but it shows you the statutes of confidentiality. So 14-6-203, confidentiality of records, and then 14-6-306 is disclosure of, I think that's juvenile data, juvenile information that's held. It says privileged information, but it is the juvenile court information. So I guess to be a little more clear on where it's at in the bill, and then we're accepting that out, we're saying that with the exception of 9-2-2104, those things still remain confidential. So only for the Department of Family Services ability to share and discuss that data with other entities.
Thank you, Senator. Committee, any questions of the bill sponsor or the director? Representative Clouston.
Thank you, Madam Chair. Thank you both for being here this morning. Two quick questions, just without going through all the statutes. So this is for ages 0 to 18, so anybody who's not an adult?
Director or Senator?
Are you talking about, sorry, Chairman, Madam Chairman, Representative Clausen, you're talking about with the juvenile data that's being shared?
Yes, thank you.
Representative.
Thank you, Madam Chair. Yes, thank you.
Did I call him Senator? No,
It's early, so.
it's really early. I'm still waking up.
Senator Olson.
But, so it's not, I guess I'm a little confused by the question because it's not limited to minors. It does include minors when we're talking about the sharing of juvenile justice data, but it also could include adults who are going through the system. Adult Protective Services would be an example.
Okay,
Committee, further questions?
one quick follow-up.
Follow up, Representative Clouston.
Thank you, Madam Chair. And then Director Schmidt, you talked about data sets that we'd be looking at. Are there any specific ones that you're expecting to look at?
Director.
Madam Chairwoman, Representative Clouston, yes, there are some specific data sets we're looking at right now. And the example that I gave about the state longitudinal educational data set, that would be a data set that we would be looking at. So that project has been going on for 10 years or so, and they are evaluating educational outcomes or work outcomes. What they don't know, what we don't know is out of those outcomes, how well are the youth that we serve, how well are they doing, so that we could be better at targeting interventions and support services for youth who are aging out of foster care, who may need a little bit more educational assistance or certification or trades. So it would help us to be able to provide better services to those youth.
Further questions? Follow up, Representative Clouston.
Thank you, Madam Chair. And then, thank you, Director. So how would you coordinate that with like the Department of Education?
Madam
Director.
Chairwoman, Representative Clouston, that already exists. So that effort exists through a steering committee that's led by the Wyoming Community College Commission. The Department of Family Services is on that board, that executive board, and the Department of Education participates in that as well. And so it's through data use agreements and memorandums of understanding that are signed by the directors, the agency heads that say, here's how we're going to engage in this process. Here's limited data that we will provide. And then there's an analysis done by the agencies kind of collectively to review that data, to clean it up, and then to produce outcomes as a result. So there is already a process with very strict data governance in place. We would just join into that effort with our data.
Additional questions? Representative McCann.
Thank you, Madam Chair. My ears always perk up when I hear the word fraud. Is that a problem as far as providers dipping in there twice? I mean, I heard that, I thought. So is that a problem, or is it just a preventative measure, please?
Senator or Director?
Madam Chairwoman, Representative McCann, we don't know. we do know at any given time there's a level of fraud, but because we don't have that data sharing with the Department of Health through their Medicaid, we don't know if it's extensive, we don't know if it exists, if it does exist. So that's one of the basic reasons for this request.
Additional questions, committee, of the bill sponsor? Vice Chair Ottman.
Thank you, Madam Chair. Director, Senator, good morning. I do have a question on this. Since this is a little bit different, I had talked to you here a while back. Since this is different, is this going to reorganize the job descriptions for your office, or everybody's going to continue on doing the same things? Okay.
Director?
Madam Chairwoman, Representative Ottman, no, this doesn't change how the work is being done. This is just, it doesn't change what we do. It just makes it a little bit easier for us to do what we need to do.
Vice Chair Ottman, follow up?
Also, I wanted to say I am glad that this is going to be a part, because working in a district, that was very frustrating to wonder, is there anything being done? Is there any follow-up? And of course, it was very quiet. And so I'm glad to hear that. With that, Madam Chairman, how are the providers chosen? I mean, how do the referrals work?
Director?
Madam Chairwoman, Representative Ottman, some of the providers are chosen because we already purchase services from them. So for example, we provide funding to the Department of Health, who then funds public health nursing, for example. And public health nursing in every community provides home visitation services. So if we're encountering a young family that has babies, that would be a logical referral to provide them with that, or to at least offer that service. So in that case, it's kind of an automatic, that service is available, the need is there, we'll make the connection. Some of the other services that we purchase as an agency on behalf of families are done through identification by the family themselves. So for example, if we have a family that's involved with us because of abuse and neglect, and the parent is already seeking treatment services or receiving treatment services from a mental health professional, then that provider has already been selected and we can support them with that.
Okay, thank you.
Additional questions, committee? Okay, I have one more. Senator Olson, on page 2, line 13, the term participation in bona fide research is used. Do you have any heartburn about limiting that to specifically just our state?
Madam Chairman, I don't, but I think I would like to hear from the department on how that might impact them.
Director?
Madam Chairwoman, could you please elaborate on what you mean by just the state?
Yep, so on page 2, line 13, it states, and participation in bona fide research. So when I think of the word bona fide, obviously friends of the department. I know you gave the example of community college, the commission here, but looking, nationwide at, research can take place from anywhere, really. And so how would you, I guess my question is, how would you limit the research, or is there an interest in limiting the research? Just thinking about the control of the data shared.
Madam Chairwoman, I would not anticipate providing data for somebody else's purposes to do their own research. If we're doing research, it's because we've requested it. So we would then, in a situation, we would write request for proposal, and then companies or entities would respond to that. And it's in that we would direct what they could do or not do with the data. And in the contract, we would further elaborate that. And then we would have memorandums of understanding or data use agreements that says there's very specific reasons that you can use the data and not for anything else. So I think the example would be as if there was a national research firm, and they apply to an RFP, and we say, you have the experience, we know you can do it. However, you cannot use our data as part of your national data set. So it's through that process that I think we could really restrict how and when that data is. And I would not, and I, speaking just as in my position, that is something that I would look for, not wanting to be very clear on what that data can be used for and what it cannot.
Thank you. Committee, any additional questions regarding the bill? Representative Gugumas.
Thank you, Madam Chair. I just want to confirm this is completely optional as far as the data I'll give you an example. Okay. I have personal experience with DFS. Okay, we had a son who was sick, cancer. Once he was in remission, we took him off the chemo against the doctor's orders or recommendation. The doctor proceeded to report us to DFS, who then came to our house and came to the conclusion there was a problem and needed an investigation. We told him our plan. It was not just throwing caution to the wind. We told them our plans, but they continued the whole process, ended up referring us to the county district attorney, county attorney's office. So I'm just wanting to make sure that this bill would not have made my life even more of a hell, because the county attorney ended up, he called us into his office and actually apologized that it went this far. He said this should never have happened. So I just want to make sure that we're not opening up a door here.
Director, on the opt-out?
Madam Chairwoman, Representative Gugumas, this is blending a little bit of two different situations that you're saying. And so I want to be very careful, because we do have some statutory requirements that if we receive a report, and we do have to look into that. That's not voluntary. That's not what this bill does. What this bill would say is, if we had talked to you and you had said, we would like voluntary services, we would like some support from other community members, if that had been your choice, then in this situation, we could contact those community resources who could then contact you. That's the voluntary part. But when we receive a report and it requires, it's at a level that we have to take certain steps, that is statutory, that is not opt-out, the way that our current abuse and neglect investigation and child abuse and neglect definitions are written.
Committee, any additional, and thank you, Representative Gugumas, for sharing your personal story. Any additional questions of the bill sponsor? Okay, seeing none, thank you guys. Please don't go far. We're going to go ahead and open it up to public comment. Are there any government agencies that would like to testify? Good morning, Director.
Good morning, Madam Chairman, members of the committee. Stefan Johansson with the Wyoming Department of Health. I'll be very brief, happy to answer any questions you have. I just wanted to hit on one thing that I think concerns about the privacy, any client of state services, privacy on their data is very well taken. One of the things this bill allows, as Director Schmidt and Chairman Olson mentioned, is for the Department of Family Services to share information with the Department of Health. We are often the funder or the payer of services that could be available, whether that's a psychiatric residential treatment facility, a community mental health center, as Director Schmidt mentioned, a developmental preschool. This helps facilitate that and not have the agencies have to wait for an emergency to react to the provision of service for very vulnerable families or children. Just wanted to remind the committee that by and large, almost in every circumstance in the Department of Health, we have state restrictions, state law governing privacy for data of Department of Health clients. In addition, nearly every Department of Health unit, program is also restricted and governed by federal law under the Health Information Accountability and Portability Act, or HIPAA. That is a very strict oversight from the federal government, largely enforced through HHS and the Office of Civil Rights. So anytime information, regardless of if we want it or not, anytime data or information that could contain protected health information, or PHI, is shared with the Department of Health, it is now under those strict guidelines of security, of privacy, sharing restrictions, et cetera. So just wanted to make that known to the committee, that when the Department of Family Services or any state agency shares information with us, we are now bound by those privacy restrictions and have to take not only physical but technical and security system safeguards with that data. It's something we take very seriously. We deal with a lot of client data and very sensitive client data. And something that just because a bill in these statutes authorizes that sharing does not mean that it goes into a void and then the Department of Health, for example, can do whatever it wants with it. We're very strictly governed by that. We do believe, especially in our work in recent years, that the legislature has authorized with the behavioral health redesign, the changes that have been made to our Department of Health facilities, the populations that we're trying to serve in conjunction with DFS and the Department of Education, that this bill is very helpful to allow us to be more efficient and identify and make referrals, provide services early, as opposed to later in someone's trajectory where we might be reacting in an emergency. With that, Madam Chair, I'm happy to answer any questions.
Thank you, Director. Committee, any questions of Director Johansson? Okay, seeing none, thank you for joining us this morning. Public testimony. Anybody like to come forward and testify on Senate File 157? We've got 3 chairs open, so if any registered lobbyists as well want to come up, please, let's fill the chairs. Good morning, Representative. Thanks for joining us early this morning.
Thank you, Madam Chairman. I'm Lloyd Larson, House District 54. Worked with the good director of DFS and Department of Corrections and Department of Health and Department of Education and the Mental Health Task Force, where this kind of had its genesis. If I may, Madam Chairman, the reason that this kind of come to light is that during our 2 years with the Mental Health Task Force, that we just seen the existence of a lot of silos. As Director Johansson alluded to, where particularly with our adolescents, where you may have an adolescent with high behavioral needs that needs services, where the Department of Family Services is responsible for the services, the Department of Health is responsible for the medical services, the Department of Education is responsible for the educational services, and that may be someplace outside the school district around the state. And there's these silos on how they're talking to each other, and we were trying to reduce those silos in making that more streamlined and more efficient. Over the last number of years, Madam Chairman, we, in probably over the last decade, one of the things we tried to do as a legislature is improve our software systems, our data gathering systems in our agencies, because they couldn't communicate with the information they was gathering. There's reference to WyoSafe, the new system in Department of Family Services that replaced YCAPS. We also have the EPIC system now in Department of Family Services and the WING system in the Department of Health that now can finally gather information and share it across systems, but we're not allowed to statutorily. And so we find ourselves not really improved. Madam Chairman, Representative McCann brought up this point on fraud, and that came up in the Mental Health Task Force. What is that? Well, because we can't share that information, it's hard to understand what's taking place in these various areas, and it is an important concern. We also, Madam Chairman, look at the adults Adult Protective Services and our others that are impacted by the Department of Corrections and these same agencies, and having the ability to share this information with them. If you look at page 4 on the bill, Madam Chairman, starting on line 12 through line 20 is the ability to share with the Juvenile Justice Information System, which has some very tight sideboards around it, but it doesn't allow the juvenile justice system, DCI, to really understand the events, the missed opportunities in juvenile's life that could have been shared with them through the WyoSafe information, because statutorily we're not allowed to. The other point that come into place is somewhat noting that we as legislators, we continue to impact this. And I would just bring to light a bill that we passed out of the House this year, House Bill 32, that in subsection D says that any state agency, department, office, or other political subdivision that collects vital statistics for the purpose of gathering accurate public data, crime, economic, and other data shall identify each person who is part of the collected data set as either male or female, consistent with the person's sex at birth. So we're requiring to gather this information. We have to be able to share it appropriately across those systems. We do that, right? And so we need to be careful that we're not hamstringing or tying the ability, restricting the ability of the agencies to perform what we're asking them to do. So, Madam Chairman, with that, we'd be happy to answer any other questions that.
Well, thank you, Representative Committee. Any questions of Representative Larson? Seeing none, thank you for joining
Thank
us
you.
this morning. Good morning. Please state your name, who you're with, and your take on the bill.
Thank you, Madam Chairwoman, members of the committee. My name is Andy Schwartz. I represent both the Wyoming Youth Services Association and the Child Development Centers. Representative Larson stole much of my thunder, as he has done for as long as I've known him. But a couple comments. My personal history related to this. I was a county commissioner for 12 years, and I was the human service liaison. And one of my jobs related to that was once a month to go to the child protection team. And that is a local coordination amongst the school, DFS, the sheriff's office, the judicial system, and the providers regarding coordination of care for youths that were in one way or another in the system, and making sure that everybody understood. And it's the ability to coordinate is difficult. This bill will help it some, but it was even clear to me then that it was not a perfect system. As a legislator, I served on this committee on appropriations, and it continued to be my focus, one of my focuses, to make sure that we are providing services for Wyoming youths and children, because fundamentally my belief is that all children in Wyoming should have the opportunity to have meaningful, independent lives. And I believe this bill is a component in making that a possibility. And I will keep it brief and stop there and answer any questions.
Thank you. And my apologies for not recognizing you as former Representative Schwartz.
That's quite okay, Madam Chairwoman.
Committee, any questions? Okay, seeing none, thank you for joining us this morning.
Thank you.
Good morning. Please state your name, who you're with, and your take on the bill.
Good morning, Madam Chairwoman, members of the committee. My name is Andy Somerville, and I'm the Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers, better known as your community mental health system here in the state of Wyoming. And I stand here today in support of the bill. For us, this is one more cleanup bill that comes behind behavioral health redesign. So between 2021 and 2024, the legislature passed 5 different bills to implement and put in place this entire retooling of the community mental health system, prioritizing populations, kind of slimming down and focusing who we provide services to. And DFS, children at risk, families at risk, and vulnerable adults is one of those particular populations. As we've been working through putting this system in place that went live last July, it seems like for the last couple of years, we keep running through things. We're like, oh wait, we got to fix that. Oh no, wait, we got to take care of that to make this behavioral health redesign project work. And this is one of those pieces. So right now, these children at risk and vulnerable adults are a priority population, and we will serve them under the state contracts at the Community Mental Health Center if that family so chooses to come in for services. But it is difficult to get those referrals because, as been stated previously, DFS cannot let us know that that family wants to come in right now. They can't send that information so that we can't call and follow them up. So what is happening is that the burden is being put on those families. So if they have contact with a family and there's a child or an adolescent that needs services, DFS is, you can be served under the community mental health system. You're a priority population. It's free of charge, but you got to call them. And as a parent of 4 kids in today's society, my day is, I think, scheduled minute to minute. It is hard to fit one more thing in. And one of the things we consistently see from families that haven't come into services or have difficulty staying in some type of mental health services that are needed is that, especially with kids, it's really, really, really difficult. It's one more thing. It's, gosh, mom is or dad is, they're working all day. They don't have time to come pick the kid up and bring him to the mental health center or coordinate those services. And we have the ability to help that. And we just want to be able to do that piece of behavioral health redesign and serve these families. So with the ability for DFS to provide us the referral, if that family so chooses, we can take the burden off of them and call them and follow up and say, this is what we have, this is what we can do. Do you have any concerns? Can we help you with that? Can we potentially see your child at the school? Can we do other pieces and try to take that burden off? I think for behavioral health redesign in general, which is generally people that have been to the state hospital or coming out, Department of Corrections, criminal justice involved, and then DFS, those are our 3 categories. The first 2 are much easier when it comes to referrals, and that process is working really, really well. As we've implemented it, the DFS population is more challenging. And from just a family standpoint, we know that if they need services and they want services and they don't get services, if the situation continues to deteriorate or if it gets worse, if you have an adolescent that's really, really struggling and they continue to go downhill, what we end up with is more serious intervention. We end up with law enforcement or something bad happening at school. And now, instead of potentially the family just needed some support services or counseling if they wanted it, now we're looking at, a child that might have to go to a PRTF or something along those lines. And that's also something from our point of view we're trying to avoid. Children are always best served with their families, in their homes, in their communities. And we just want to be able to fulfill our new mission as a community mental health center from behavioral health redesign in the best way possible and help these kids. So I think overall, to us, this is just one more cleanup bill behind behavioral health redesign that would allow us to fully implement that. Madam Chairman, I'd be happy to stand for questions.
Thank you. Committee, any questions for Ms. Somerville? Okay, Vice Chair Ottman.
Thank you, Madam Chairman. Ms. Somerville, it's good to see you again. I did know and realize that the behavioral health reorganization or whatever was going on, but I have a couple questions, and whether it's you or Director Schmidt, I'm not sure. But my questions go along with if the families, if you contact a family and there is things going on and they say, no, we don't want to be involved, can that be taken and reported then as neglect? And I'll just give you a couple of them so that you can just kind of answer me. And then also down the road, when this person applies for jobs, is there any way that this record would come up and be reported? And then do these records, because they said there's a number a client number. So does this record in particular show up, like say a child has some mental health issues because of situations, and they work through that and they are better, does it still show up that they have a mental health problem? And then also I heard that the education community was pretty divided on this. So I'd like to hear your response to that.
Ms. Somerville, your choice, whatever order you'd like to take them.
Madam Chairwoman, Representative Ottman, I think I'm going to start at the top, and please remind me if I've missed one here. So counselors by law are mandatory reporters. So if they have firsthand knowledge that something's going on, so that would come from the family, right? Then they would be required to report that. But in the situation you're describing, that's not that I don't think there would be a report generated. So if we follow up on a referral and we call a family and we say, hey, we got this referral, we have these services, would you like to come in, do an assessment or do something like that? And the family says, no, then the answer is no to us. So you have to have, whether for both adults and adults have to give permission for anybody under the age of 18 to provide mental health services to them in the state of Wyoming. So I don't have a concern with that. You asked a couple of questions regarding records and where does that go? So first thing that I would just share with the committee is mental health records, and then substance abuse records are even more protected, but they are the federal requirements around protecting that information they are substantial. So not only are they covered under HIPAA, but there's other things that cover those records. For substance use, you have to have very specific special types of releases signed to access any of that data. And if you've ever looked at a health form that's like at your doctor's office that says, you release my x-rays and my notes and my whatever, you'll always notice there's separate boxes on those forms for mental health and for substance use. So for us as providers, that information in those records stays within our system. We would not be releasing those into, I can't imagine where we would release those. Now, for the state contract, there are, obviously that state contract is paid for by the Department of Health. So if they are under behavioral health design, there is a data system that we share with the Department of Health that's run by the Department of Health, and they have all the data controls on that information because we have to bill the state for those clients, but that information stays within that system. I'm not aware of any data system that would allow somebody to be flagged potentially for employment, or, you're 15 years old and you got treatment, now you're 18 years old. Those data links don't exist. There's no system where that information would leak out. The providers are all under a pretty rigorous legal onerous to keep all of that information very safe, very secure, and it doesn't go anywhere. And the last thing I would just add is that is absolutely essential to providing mental health or substance use services. We all know that comes with still a stigma. People have hesitancy about entering counseling. And so it's really important on our side of the house that we can provide that reassurance to clients and patients that come in the door that, yep, we're going to keep this information private. It doesn't go anywhere. We are here to help you to get better. That's incredibly important. So, Madam Chairwoman, Representative Ottman, I don't know that I got all of them, but I think I got the gist of what you were asking, which is there anywhere that this data could come back up later and show up somewhere, or be released somewhere else? And the answer is no.
Thank you, Ms. Somerville. Any further questions? Okay, seeing none, thank you for joining us this morning for your testimony. Any further public comment? Mr. Caldwell, do we have anybody online? Nobody online. Okay. Oh, one. Senate File 157. Okay. Good morning. Please state your name and who you're with and your take on the bill.
Good morning, Chair and committee members. My name is Laura Pavey, and I am here today to rise in strong opposition of SF 157. This staggering scope of the bill as assault on family privacy isn't just dangerous. It represents an unprecedented intrusion in the private lives of Wyoming families that could follow them for decades. This bill would effectively dismantle fundamental privacy protections while creating permanent surveillance systems of Wyoming families. It authorizes unlimited data sharing across agencies without allocating a single penny for security, infrastructure, or establishing any meaningful limitation on how the data can be used to monitor or profile citizens. When we examine the dismantling of these privacy protections really means for Wyoming families, the implications are chilling. Consider a family that experiences a temporary hardship that seeks assistance. Under the current law, that interaction remains in the private with that specific program. This bill would change everything. It would allow agencies to create comprehensive family profiles, combining every contact with every state service, from school records to medical decisions to temporary assistance, into permanent digital dossiers that could follow the family forever. This isn't just about data sharing. It's about creating a system where families never truly escape the governmental surveillance once they've entered into it. Every interaction with any state agents could refresh their profile and trigger new scrutiny. A family needing temporary help years ago could find themselves flagged as high risk during a routine school matter. The heightened scrutiny creates more data points, building ever-growing profiles that could subject them to escalating levels of supervision and intervention. These aren't just hypothetical concerns. Right now, in our legal system depends on privacy walls, and different systems separate attorney-client privileges, sealed and juvenile records, confidential family court proceedings. All the protection becomes vulnerable when we start punching holes in the privacy laws. We would undermine the very foundation our justice system is creating, a mechanism for unprecedented government into family lives. The risks aren't theoretical. They've demonstrated their own recent history. In 2022, our department that oversees health experienced a catastrophic breach that exposed protected health information to over 164,000 residents in Wyoming, nearly 1/3 of our population. That security failure happened under the existing and stronger protections are needed. Now that the bill asks us to deliberately weaken the safeguards while creating an even larger, more tempted target for cyber criminals. The fiscal implications are staggering also, but the cost of human privacy is even greater. The system would warehouse our family's most intimate details in a centralized location, creating profiles that could be used to flag families for heightened scrutiny based on the pattern and analysis rather than actual concerns. Yet the legislature has failed to allocate any funds for the security infrastructure or establish any limitations on how this information can be used to monitor Wyoming citizens. Some of the suggestions I have is adding an opt-out provision that could address these concerns. Wouldn't. Once the information is in the system, it becomes part of a permanent profile that could influence every future interaction with the state agency. More troubling are vulnerable citizens, children are welfare systems, families seeking temporary assistance, adults under protective services, have no meaningful ability to opt out. They depend on the essential services, forcing them to choose between accessing critical services and protecting their privacy. It is morally inconsiderate. Every additional data sharing point multiplies the vulnerability exponentially. Every transfer, every new access point, every cross-department sharing agreements creates new opportunities for breaches and expands surveillance capabilities in the system. And for what purpose? The proponents of this bill haven't demonstrated any failure to current evaluation methods or shown why existing tools are insufficient today. They're asking to create a permanent surveillance system around Wyoming families without showing clear benefits. The House has already rejected a dangerous bill such as to this approach. They reconsidered these serious privacy and security concerns. And let's make Wyoming let's not make Wyoming constituents guinea pigs for a dangerous experiment that could trap generations of Wyoming families into permanent surveillance systems. I strongly urge you to vote no on SF 157 today. Thank you. I stand for questions.
Thank you. Committee, any questions of Ms. Pavy? Okay, seeing none, thank you for joining us
Thank
this
you.
morning for your testimony. Any further testimony? Okay, committee, seeing none, no, is there anybody online? No, okay. I will close public comment on Senate File 157. Committee, what is your pleasure?
Madam Chairman, I'll move the bill.
The bill's been moved by Representative Yen, second by Representative Clausen. Discussion and amendments on Senate File 157. Representative McCann.
Thank you, Madam Chair. I just find it a little weird that you got two people on this panel that have negative experiences with DFS, so I think we need to be careful what we allow them to do.
Committee, any
Me being the second one, sorry, I didn't.
committee, any additional questions on the bill or amendments? Representative Clauston.
Thank you, Madam Chair. I think this bill's been in the works for quite a while. I think it's pretty well vetted, and I think it'll actually help improve the communication and improve our processes here in Wyoming.
Further discussion or amendments? Okay, seeing none, sensing the urge to vote. Mr. Caldwell, if you'd call the roll on Senate File 157.
This is a roll call vote for Senate File 157. Representative Clausen,
Aye.
Representative Guggenmoss,
No.
Representative Heft, Representative McCann, Representative Ottman,
Aye.
Representative Stivar, Representative Wasserberger, Representative Yen,
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 4 aye, 4 no, and 1 excused.
Okay. Senate File 157 has failed. Committee. We will, thank you, Representative, or Senator Olson, for joining us this morning. Senate File, we'll move on to Senate File 175 and place it on the table for the committee's consideration. The bill is titled Unemployment Insurance Coverage Period and Reporting, sponsored by Senator Kolb. Good morning, Senator Kolb. Please come forward and present your bill. Good morning.
Morning, Chairman, members of the committee. Hi, Senator John Kolb, Senate District 12. Hope this bill goes better than the last one. So just to explain it, I'll try to do a high-level overview. And I will also put the caveat in here. I've tried to do the best I can with these numbers to make them as accurate as possible. I will tell you, it is not that easy to get accurate numbers because the way you look at them, they swing slightly. So I've done the best I could do to represent this in a fair and open manner. So what the bill does is lowers the maximum amount of unemployment weeks benefit from 26 weeks to 20 weeks, or 6.5 months to 5 months weeks, and renames the UI Unemployment Commission to the Reemployment Commission. And that was more of a philosophy about, you know, our goal is to get folks back to work, to reemploy them, not to keep them unemployed. And it's not a slight against the unemployed, it's just a philosophy of what we think is the right way to go. And once again, this is a policy decision for this committee. I would like to also give a little bit of information, color to other states that have done different things, and the amount of time they give for unemployment compensation in weeks. And I'll start off. Missouri and South Carolina are both at 20 weeks. Idaho, Arkansas, Oklahoma, are at 16 weeks. Alabama's at 14 weeks. Georgia, North Carolina, Kentucky, and Florida are all at 12 weeks. So that's a bit of a color for the background on what other states are doing now. And also, there is no correlation to unemployment rates changing much throughout these. I went through all the data and to see if there was something to do with, you know, if a state had a lesser amount of time, does it change the data? Does it have more amount of time? Does it change the data? And no, there is no correlation. It's all over the place. And it may be the way they report, because like I say, Wyoming, and they do the best job they can, and they do, and they've actually launched a new website active today. I found out yesterday trying to get accurate, updated information because it always lags a bit. But that gives a bit of color for the rest of the United States. Now, for Wyoming, we had a 12.8 weeks, or a little over 3 months, was the average unemployment time taken. So roughly speaking, 91.7% do not use the maximum benefits, or 8.3% do in 23. Once again, it varies to the year. And so, and with more color, December 23rd to December 24th, the jobs available in the state of Wyoming actually increased by 5,100, or a 1.8% increase. So I'll just go down to a more of a summation now. Wyoming is a very strong employment in the state. We have low unemployment. Rate is currently 3.5%. Jobs are available. This bill will lower the cost to employers for employment and help Wyoming businesses stay in business. It's a benefit. And I'll add a little bit more to this, is that our fund is in fact the highest funded fund, certainly per capita, in the United States of America. There is 542 million plus in this fund. It generates on a 5-year average $21 million of excess revenue, which is a great thing. I think the Workforce Services is doing a great job managing this. That's with all their training. That's with everything else they do. They still come ahead. I would put forth the position that this will certainly move us towards a self-funding fund and to decrease the cost for employers. And that's the reason for it. And once again, this is a policy choice for this board, this committee to make. I just want to try to lay the facts out. I'm going to leave it up to you, the committee members, to make your decision. So I'll try to do the best job I can in conveying that. And, so this change will get Wyoming workers back to work sooner for the purposes of just that, because we do have plenty of jobs. Once again, a policy decision, a data-driven point of view I have. It's not, mostly I'm supportive of Workforce Services. I think they're doing a great job. It's obvious by the health of this fund. But I think we have to be responsible to businesses in the state of Wyoming and bear responsibility to the employer and employees that we provide a safety net. And we do. Months extra worth of time. And there's a federal safety net that was modified in this bill when it came through the Senate. We found out that we couldn't change a federal statute that was used twice, but last time was during COVID. And it allows for extended benefits. So there is a safety net in here in case things really go off the rails and we have a massive problem like we had, frankly, through no fault of our own with COVID. So there is a mechanism built in here to cover that rare, hopefully always rare instance. And I'll stand for questions, Madam Chairman. I look forward to a good debate.
Thank you, Senator. Senator, a quick question on your effective date. Why is it so far out?
Well, thank you, Madam Chairman, for that question, because it does look kind of weird, doesn't it? Well, the reason is because the department requested it. Originally, the effective date was a standard effective dates, but being the way the quarters hit, it was recommended that we change that date to that very particular date so they could transition more easily. And to accommodate them, I had made the amendment on the floor, and that's why it looks a lot different than other effective dates. But thank you for the question, Madam Chair.
Thank you, Senator. Committee questions of the bill sponsor. Vice Chair Ottman.
Thank you, Madam Chairman. Senator, how are you?
Good.
Good, thank you. Two questions. First off, why do we need another committee? I mean, I see it's the Reemployment Insurance Commission, and that's great. And then secondly, how would it work that, because I'm not familiar with the system, but how does it work that lowering the amount of weeks could lower the cost to the employers?
Senator?
Madam Chairman, Representative Ottman, first question was why the name change? Well, we already have a commission. Just changes the name of the commission. It doesn't add a commission. It doesn't change anything there. Just a name change. Well, it'll lower it because there's going to be less people going up to maximum benefits. So it will lower the cost. I mean, there is a much broader question here to that point that we have not touched with this bill, and that is probably the being self-funding point of view. But anytime you lower the cost of those benefits, it'll reflect back in the aggregate cost to each member for their rates they pay. And it does vary. They use I wouldn't call it complex, but they have a formula that is based upon a number of factors that they use. So decreasing the maximum amount of weeks taken will decrease the cost to the fund. And I would also then add on that, frankly, we have folks, not that many, but that run out full benefits. And I would contend that if we offered 30 weeks, they would take 30 weeks. If you offered 50 weeks, they take 50 weeks. And it's not a slight on the people taking the benefits, it's human nature. So I do believe it will decrease the cost because of that. The amount is an unknown factor because they do calculations to figure that out, to actually see what the rate is for the employer.
Committee, further questions? Representative McCann.
More of a statement, just to complement what the senator was saying. You see this in medicine as well. People are, they're probably ready to go back to work, but they're going to take the max that they can do. The greater majority say, hey, send me back to work, because they get bored. But there's a few people out there that'll take the max to complement his statement. That's all. Thanks.
Thank you. Further questions? Representative Yen.
Madam Chairman, thank you. Senator, the renaming portion, so I understand your impetus for doing it, but are you worried at all that it's going to create confusion when people are unemployed and they generally, I think both employers and employees generally understand it as unemployment insurance, and they try to search for unemployment insurance and it doesn't show up? Do you think that could cause a problem?
Senator Kolb.
Madam Chairman, Representative Yen, yeah, possibly it could. I'll just tell you, members of the committee, Senator Kolb's not dying on this hill for the name, all right? I thought it was a good idea because it sends a good message. And if the committee so decides they don't like that name change, so be it. It's up to you, but it was about a state of mind, Representative Yen, Chairman Rodriguez.
Further questions, committee? Representative Wasserberger.
I guess just to bounce off of our senator's comments too, I would imagine when you apply for unemployment, when you get approved, they probably let you know when your due dates are up for unemployment. That's my thought.
Further questions, comments? Representative Klauston.
Thank you, Madam Chair, and thank you, Senator, for bringing this. You and I share similar philosophies on quite a few things here. You mentioned states, how many weeks they have. So there's 2 states that have more than 26 weeks. There's the 7 that have less that you mentioned. And then there's, I think, 39 states that are at 26 weeks, and that's where Wyoming currently falls. Do you know how many of our people, percentage-wise, hit the full 26 weeks of benefits?
Senator Kolb.
Madam Chairman, Representative Klauston, what is it, 8.3% of total people run full maximum benefits out.
Follow-up, Representative Klauston.
Thank you, Madam Chair, and thank you, Senator. You mentioned the federal exceptions. I haven't had a chance to look, but do any of the states have state exceptions? You know, someone hits 20 or 26 weeks, but is there a process for them to extend those with the state?
Senator Kolb.
Madam Chairman, Representative Klauston, I'm not sure about other states having that program. I just know that we do have a safety net built in here that's federally mandated. And I think the department could probably elaborate better than I about that, Chairman.
Any additional questions regarding the bill? Okay, seeing none, thank you, Senator Kolb. Don't go far.
I will not, Madam
Okay.
Chairman.
Are there any government agencies that would like to come forward? Again, we're on Senate File 175. Good morning. Please state your name and who you're with, and we'll hear your take on the bill.
Good morning. My name is Liz Gagan, and I am the Director of the Department of Workforce Services. And with me, I have Holly McCamey Simone, and she is Administrator for Workforce Programs. And depending on your questions, she may need to help me answer them. So I just want to talk a little bit about where we are kind of with UI in Wyoming right now. Unemployment is 3.5%. It rose slightly in November, and that kind of follows Wyoming's normal seasonal pattern. Typically, employment increases from the first quarter to the second quarter. It peaks in the third, and then it drops in the fourth. But a year ago, our UI rate was 2.9. So it is going up, and that is kind of following a national. Nationally, it's doing that as well. The national UI unemployment rate is 4.1, and Wyoming's is the 20th lowest. The national economy is slowing, and other than construction, Wyoming is not seeing any strong growth right now. And I want to talk a little bit about the history of 26 weeks. In 1957, Wyoming adopted the 26-week maximum. There was no maximum prior to that. And all states, kind of post-World War II, adopted these 26 weeks. And then in 2010, many states were having issues with UI debt. Their UI trust funds couldn't cover the payments that they were paying out, and they had to borrow money from the federal government to make those payments. And so then some states started to cut back the duration of their benefits. And as Senator Kolb discussed, states who have less than 26, I do want to talk 35 of 53 state UI programs during the recession did have to borrow money from the federal government, and Wyoming did not because our system was strong enough to be able to provide those benefits. So as far as our neighboring states, Colorado, North Dakota, South Dakota, Utah, Nevada all offer up to 26 weeks. Idaho offers up to 20 weeks, but it could go up to 26 weeks depending on what their unemployment rate is. Arizona offers up to 26 weeks if UI is greater than 5%, and then Montana offers up to 24 weeks. One thing that I want to discuss is that shorter limits on potential durations can curtail productive job searches and may result in kind of inferior job matches. So that's one thing that I want to discuss a little bit. Cutting benefit weeks may impact highly skilled, highly paid folks. I did provide you with a spreadsheet that shows the occupations from 2023 who were on UI for more than 20 weeks. And if you look at the top four, they're fairly high paid, highly skilled jobs. Operating engineers was the largest, and then we had general and operations managers were both really highly paid folks. which also, I want to talk a little bit about wage replacement. UI's wage replacement, doesn't obviously offer you what you would make if you were currently working. And the more you make, the less that wage replacement is going to be. So for some of these folks, like the general and operations managers, they receive about 12% of their wages when they are on UI. We also, this bill was introduced 2 years ago. So we looked 2 years ago to see which occupations then were on UI for longer than 20 weeks. And then it was operating engineers, Then it was petroleum engineers and rotary drill operators, and there's probably a result of so many rigs that shut down during the pandemic. So a lot of what we see too is who is going to be on UI for longer than 20 weeks is really kind of dependent on what's going on in the economy. And since we are talking about highly skilled kind of UI claimants, I want to give you a little kind of update on the federal employees who were kind of recently fired that we've all probably heard a lot about. As of yesterday morning, we have had 47 unemployment claims filed by federal employees who were recently let go from their jobs, 29 at the Department of Agriculture, 11 at Interior, and then the remaining come from 4 other federal agencies. And about half of these claimants are from high skill kind of niche areas. They're biologists, they're foresters, rangeland management, trails technicians, and these types of jobs. The other half, have skill sets, a fiscal area, human resources, IT, and so it'll probably likely be a little bit easier for them to become reemployed sooner. I do also want to point out that the UI benefits that are paid to these federal employees do not come out of our UI trust fund. They come from a separate fund that is paid for by the federal government. So this will not affect any Wyoming taxpayers' taxes. But these UI benefits that the federal employees receive are the same that any other employee living in the state would receive. We do offer reemployment services. We have a fairly new program that's kind of a rapid reemployment service. Every week, we use an algorithm that chooses the 40 claimants that appear to probably will likely have the longest duration, and we meet with them regularly, offering them services, making sure that they are looking for the right jobs and trying to find them kind of the best fit that they may need. And I also want to point out that there are a number of UI claimants who are in retraining programs. And if you were in approved training while you were on UI, you don't have to be actively seeking work at that time. So we have currently, or in 2024, we had approximately 137 people who are in retraining programs. A lot of that was for CDL, which is not a long program, but it could be nursing, electricians, apprenticeships, and those types of things. And those people do tend to be on UI a little bit longer to kind of account for this retraining period of time. And I do want to talk about the CARES Act because it did come up when this bill was heard in the Senate. And in 2020, the legislature during its special session passed Senate File 102. And this gave the governor authority to non-charge UI benefits that were paid. And Governor Gordon issued 2 executive orders to this effect. And the second executive order effectively non-charged any benefits that went to an employer's UI account for the time period of March 13th, 2020 through December 31st, 2020. And there was $122 million of CARES Act money that was put into the UI Trust Fund to keep it actuarially sound when we were not charging employers for benefits that were paid to their employees. And so this kept UI tax rates low for two distinct reasons. The first is this non-charging, and so this kept employers' base rates much lower than they would have otherwise been. And then second, there's part of UI taxes that's called a fund balance factor. And so when we're setting UI taxes, we have to look at the fund balance. And because of this infusion of money, the fund balance was above 4% of total payroll. So that ended up being a negative factor within further reduced UI taxes. And what resulted is that for 3 years in 2022, 2023, and 2024, we had a minimum UI tax rate of 0%. And a 0% minimum tax rate had never happened before. So any employer who was experienced, meaning they had been in business for more than 3 years, who didn't have any benefits charged against their counts, paid zero state UI taxes for those 3 years. And that was about half of the experienced tax rate who had 0%.
Director, the trust fund, the 122 million that was put in the UI trust fund, was that all expended? Was that all used or depleted, or was it rolled over? What's the status of that now?
Madam Chairwoman, it was all used to non-charge. So yes, it was used. We had any money that went into the fund was used to kind of wipe charges off of employers' accounts.
Thank you.
Okay. And I certainly agree with Senator Kolb when he says that it will lower UI taxes, but it's really, really difficult to try to quantify that. And this is why. Certainly, if you were an employer who had an employee who was on UI for more than 20 weeks, your UI taxes will be lower because the benefits charged to your accounts will be lower. But there are other employers that it's really difficult to kind of determine what it may or may not mean for their tax rates. It's certainly not going to result in anyone's tax rates being any higher. But for businesses who have been in business for less than 3 years, they aren't experienced rated. And so their tax rate is determined by the industry that they are in, by their NAICS code, which is a North American Industry Classification System. So, I mean, it would just depend on, their industry and how many folks in their industry may have been on UI for more than 20 weeks. So it's really difficult to tell how much, if much, it would apply to them at all. And it's about 37% of UI taxpayers who use this industry classification instead of an experience rating. And then for your employers who are at the minimum tax rate, so for 2025, the minimum tax rate is 0.14%. There could be some difference in that tax rate, but essentially those employers, and it's about half of all employers are at that tax rate. They are paying currently about $45 per employee per year, and that's up to. Our taxable wage base is currently $32,400, and so employers only pay taxes up to that amount of wages. But of course, several people, if you're working part-time and that type of thing, you don't get anywhere near the $32,400. And so with that, I stand for any questions.
Thank you, Director. This is the first time you've come before our committee, so I appreciate you being here. in committee, if you're not on Workforce Services mailing list, you should get on there. They produce some quarterly reports that have pertinent information to consider when we take up bills in this committee. So committee, any questions of the director? Representative McCann.
Thank you, Madam Chair. Mainly just a point of interest. On this retraining that you do, once they've completed the training, how long do you keep them on the benefits? Or how long, what's the grace period as far as them get to work? How long do you allow for that?
Director.
Madam Chairwoman. Representative McCann, there wouldn't necessarily be a grace period. So it would depend on, how many weeks. I mean, if you were at 26 weeks, then, I mean, there's no grace period. You would, if you finished your training program and you're at 26 weeks, you wouldn't be entitled to unemployment insurance benefits anymore. And then once you are out of that training program, you then have to actively be seeking work.
Committee, further questions regarding the bill? Representative Yin.
Madam Chairman, Director Gagan, thank you for joining us. So just to clarify that, the only thing that the doing retraining does is suspend your requirement to look for work during that retraining period. You get the unemployment insurance without having to apply for a job and have interviews while you're retraining. Is that correct?
Director.
Madam Chairwoman, Representative Yin, correct.
Committee, further questions for the director?
One more, Madam Chair.
Follow-up, Representative Yin.
Madam Chairman, thank you. Director, so the 26 to 20 change, you talked about how we have those federal employees that are getting unemployment, but that's funded by the federal government. If we drop this to 20, would that still also restrict them from getting 26 weeks? They would get down to 20 weeks?
Director.
Madam Chairwoman, Representative Yin, yes.
Additional questions of the director regarding the bill? Representative Clouston.
Thank you, Madam Chair. Thank you, Director. Is the maximum benefit you can receive, is it $624 a week?
Director.
Madam Chairwoman, Representative Clouston, correct.
Okay. And then follow-up.
Follow-up, Representative Clouston.
Thank you, Madam Chair. Have you guys done the math on savings to the state if we went ahead and followed this proposed bill?
Director.
Madam Chairwoman, Representative Clouston, it's really difficult to tell. Yes, the maximum benefit is $624 a week, but of course, not everybody receives that amount. The amount that you receive is based upon your wages. And also, I mean, we could look back at the last 2 years to try to determine, but UI is so dependent on what's going on in the economy, it wouldn't be a very accurate number.
Additional questions, committee? Okay, see none. Thank you, Director. Oh, one more, Representative Heft.
Thank you, Madam Chairwoman. Just a comment. In the industries that you indicated here, that are the highest, they're generally on unemployment 3 months. So we're still sitting, even if we reduce it to 20 weeks, we're still sitting at 5 months. I would think that's more than an adequate amount of time for those folks in those industries.
Director.
Madam Chairwoman, Representative Heft, I've read, obviously I've read and what the experts say is that in normal economic times, it's not likely to take someone 26 weeks to become reemployed. But there are those times where it may take that long. But generally speaking, it is not going to take the average person 26 weeks to become reemployed.
Further questions, committee? Representative Clauston.
Thank you, Madam Chair, and thank you, Director. Just point of curiosity, the people receiving the benefits have to pay taxes on the benefits received, I believe. Is that correct?
Director.
Madam Chairwoman, Representative Clauston, correct.
Follow-up.
Follow-up, Representative Clauston.
Thank you, Madam Chair. Has there ever been any legislation or movement to try to remove the taxes on unemployment insurance?
Director. Madam Chairwoman, Representative Clauston, not that I am aware of.
Committee, additional questions of the director? Okay, seeing none, again, thank you to both of you for joining us this morning. You're welcome anytime. Further public comment? We've got 3 chairs up here, so members of the public, registered lobbyists, if you'd like to come up and testify on Senate 175, please do. Good morning.
Good morning again.
Please state your name and who you're with and your take on the bill.
Good morning, Chair and committee members. My name is Laura Pavey, and I am speaking to you today in support of this bill, 175 Unemployment Insurance Coverage Period Reporting. This legislation embodies core Wyoming values of self-reliance and fiscal responsibility while addressing fundamental issues with our current unemployment system. The beauty of this legislation lies in its simplicity and its efficiency. With just $18,000 appropriated for implementation, we are proposing a reform that completely reframes our approach to unemployment assistance. This modest investment carries a profound message. Wyoming stands for work, not dependency. This reduction of the maximum benefit period from 26 to 20 weeks is firmly grounded in economic research. Studies consistently demonstrate that most claimants secure new employment within the first 12 to 16 weeks by maintaining a substantial safety net while adjusting to the time frame. We create stronger initiatives or incentives for rapid workforces reentry without abandoning for those truly in need. This adjustment aligns with Wyoming, with several neighboring states that have successfully implemented similar benefits. Their experience show that the faster reemployment rates and reduces burdens on unemployment trust funds. This isn't about being harsh, it's about being effective. Renaming the commission from unemployment insurance to reemployment insurance represents far more than a superficial change. This shift fundamentally alters how both claimants and employers engage in the system. It signals the state's commitment to viewing these benefits as temporary bridge to meaningful employment rather than indefinite support. Despite global economic uncertainties, Wyoming unemployment rates remain below the national average. Our labor market currently has the capacity to absorb the workers more quickly, making this precisely the right time for implementing these changes. Wyoming businesses will benefit through potentially reducing unemployment insurance rates over time, allowing the investment more in growth and additional hiring. Workers benefit from stronger pathways back to self-sufficiency, and taxpayers gain from improved fiscal responsibility in our government systems. It's worth noting that the unemployment compensation for federal employee programs allows federal workers who lose their jobs through no fault of their own to access benefits through state reimbursement states for payments, typically up to around $400 weekly for 26 weeks. This federal structure highlights the importance of the state level consistency with reform. Senate 175 represents sound, thoughtful reform that benefits workers, employers, and taxpayers alike. I strongly support this bill and for this important legislation that reinforces Wyoming's commitment to dignity through work. Thank you, and I stand for questions.
Thank you. Committee, any questions of Ms. Patty? Okay, seeing none, thank you for joining us this morning. Ma'am, please state your name and who you're with, and we'll hear your take on the bill.
Thank you, Madam Chairwoman and members of the committee. I'm Marcy Kindred, Executive Director of the Wyoming State American Federation of Labor and Congress of Industrial Organizations, representing thousands of hardworking families that choose to make Wyoming their home. We're here to discuss concerns on how Senate File 175 would impact our workforce stability. In 2023, 1,041 Wyoming workers needed more than 20 weeks of unemployment benefits. It's a very small segment of the total claims, but this isn't an insignificant number. These aren't just numbers at all. They're our neighbors, equipment operators working through brutal winters, truck drivers navigating boom and bust cycles, and skilled tradespeople who've built their lives right here in Wyoming. Unemployment insurance is a critical tool that helps our state retain its skilled workforce. It's not a handout. It's insurance that we earn through our labor. When our roughnecks face an energy downturn or when construction pauses during harsh Wyoming winters, this insurance allows our skilled workers to stay in our communities while they transition to their next opportunity. The reality of Wyoming work has always been unique. It's seasonal, it's cyclical. Those 26 weeks of benefits are rarely used as one continuous block. They're typically stretched across a full year as we navigate our resource-based economy. 3 weeks during weather delays, 2 months while a project awaits permits, another week between contracts. This flexibility is what makes this system works for Wyoming's specific needs. What's worth noting is that, and it has been stated, our unemployment trust fund stands strong and so robust that employers often pay very low premiums. Our UI system already ensures industry with higher layoff rates. They naturally pay a higher premiums when contributions resume. And this bill would spend $18,000 of our taxpayer money to implement a change and rebrand that would ultimately harm fellow Wyomingites. That's not how we treat our neighbors in Wyoming. We Wyoming workers have always taken pride in our work ethic. We don't need a program renamed from unemployment insurance to reemployment insurance to motivate us. We want to work. And more importantly, we want to work right here in Wyoming, contributing to the state that we love. The question before you today is whether we want to keep our skilled workforce in Wyoming. It's about whether we want roughnecks, welders, and truck drivers to remain part of our communities during temporary layoffs, continuing to contribute to our state's economy and future. We respectfully urge you to vote no on Senate File 175 and help keep Wyoming's workforce strong. Thank you for your time, and I stand for any questions.
Thank you for your testimony. Committee, any questions? Vice Chair Ottman.
Thank you, Madam Chairman. Thank you for your testimony. I heard, and maybe I heard something different, but one place I heard that the trust fund is well and huge, and in one place I heard that it had been used.
Ms. Kendrick, right? Ms. Kendrick.
Yes, Chairwoman, Representative Ottman. It had been used, I'm sorry, I think I need clarification on the question.
Ottman, if you
Used
can clarify
for,
your
used into totality, used?
The Director of Unemployment Insurance, I thought maybe I misunderstood, but I thought that it had been used. I thought that's what she said.
You could possibly be, thinking of the CARES Act funding that was allocated through the executive order. Yeah. Further questions, committee? Okay, seeing none, thank you for joining us this morning. Sir, please state your name, who you're with, and your take on the bill.
Good morning, Madam Chair, members of the committee. My name is Jeff Daugherty here on behalf of FGA Action today. I'm so grateful to the sponsor for bringing this bill forward and for this committee's consideration of the bill, and I'm absolutely going to encourage you to support this bill. Madam Chair, I have to tell you that in my view, work is a blessing. Work gives purpose. And I think this bill will help us get folks back to work. Some of you who know me know that in my past life, one of my responsibilities was to be managing the construction of schools around the state. One of our biggest challenges that was constant was trying to find people to help us do that, and trying to find pipe fitters and roofers and carpenters to help us maintain our schools around the state. And I will tell you, you've heard testimony, and I agree with it, Madam Chair, that the abuse of this fund is rather low. The majority of people actually do want to get back to work. And so I think what this bill does is it right-sizes that window to something that's somewhat greater than the amount of time that most people are needing to get back to work. One of the things I wanted to touch on, based on the previous testimony, the department director always does such a great job with testimony, but I want to point out that with regard to those federal workers, the effective date of this bill is after the 26 weeks that would apply to those folks who are going to be affected by federal job changes. And I also want to point out that a lot of the discussion that I've heard today looks like there are significant concerns about the unemployment insurance rate. And so maybe that's something we look at in the future. I will tell you that I also support the training, but I want to remind the committee that that benefit that's used to pay for the time while they're on the training is paid for by employers around the state. And retraining is great, but I want this committee to be mindful that it's provided as a result of the many employers in the state of Wyoming who contribute to that fund. So Madam Chair, I know that there's a bill after me. I have additional comments, but I'm going to stop there and just answer any questions if there be any.
Thank you. Committee, any questions of Mr. Daugherty? Okay, seeing none, thank you for joining us this morning.
Madam Chair.
Sir, good morning. Please state your name, who you're with, and your take on the bill.
Good morning. My name is Dale Steenberg, and I'm President CEO at the Greater Cheyenne Chamber of Commerce, and I also represent the Wyoming Chamber of Commerce. There is something important that when the senator introduced this bill that we need to pay attention to. He listed off a number of states. I couldn't catch them all. I caught Missouri, I caught South Carolina, I caught Georgia, I caught Oklahoma, at least those four that I caught. What do those states have that we don't? They're in the top half of states in the United States for doing business. One of our challenges is that while Wyoming has a very low tax rate, our cost of doing business is high. One of our costs is the issue that we're speaking about today. The second thing that I'd ask the committee to think about is that if you drive west out of Cheyenne, you're going to see a giant billboard, and it says, it's changed a couple times. Last time I saw it, $31.65 an hour if you'll come to work for us. I have never spent a day as CEO of the Cheyenne Chamber of Commerce where I didn't have an employer calling me desperately seeking employees. We need to do anything that we can to encourage people to go back to work, and we've heard it a lot. Most of our people do, but we need to have laws for the people that aren't playing well within the game. So you can lower costs for business, help them with their worker shortage, and help us drive ourselves up the ranking so that our goal is to be in the top 25 of businesses in the US. We'd like to get there quickly. So your support of this bill is greatly appreciated. Thank you. Happy to answer any questions.
Yeah, thank you. Committee, any questions of Mr. Steenberg? Okay, seeing none, thank you for joining us this morning. Good morning. Please state your name and who you're with, and we'll hear your take on the bill.
Madam Chairwoman, Rennie McKay, President of the Wyoming Business Alliance, and several of you have heard this. We represent businesses of all sizes, from all industries, from all corners of the state, and our top priority as the Alliance right now is workforce. As Dale just mentioned, we've got a situation where I don't know any industry that's not facing a shortage right now of workers. So I really appreciate the sponsor for bringing this. We are watching this bill really closely. There are several factors I think that I'll just bring up that are really important. And one is that right now we actually we're down a little bit off the peak, but we're about the highest number of jobs in Wyoming in our history. And if we're not at the peak today, we're just below it. We just crested it. And the situation though is that we don't have the most workers working because we actually are losing folks. So right now, if you took everyone who's on UI and put them to work, we would still have thousands of vacant jobs in Wyoming. So there's a few factors that we just have to keep an eye on, and the Business Alliance is going to be very focused on this issue. And so we could be back in front of you at another point because we've got to be finding solutions for all of this. And then the other part of it is that I do really appreciate the Department of Workforce Services. They're a great partner to so many businesses and industries when it comes to internships, apprenticeships, upskilling. It's really important right now. The marketplace is changing a lot, and our members are always looking for people who have a new skill available to them. And so there's a lot to look at as we move forward. So thank you for looking at this bill. I thank the sponsor for bringing it because, again, workforce is so important to the businesses of Wyoming. Thank you.
Thank you. Committee, any questions of Mr. McKay? Okay, seeing none, thank you for joining us this morning. Is there anybody online, Mr. Caldwell? Okay. Okay.
Can you hear me?
Yes, good morning. If you'd state your name and who you're with, and we'll hear your testimony on the bill.
Good morning, Madam Chairman. My name's Phil Cornella. I represent the International Union of Operating Engineers. The Wyoming Operating Engineers specifically. We have a union hiring hall here in Wyoming, and then a joint apprenticeship program where we teach people how to run heavy equipment on various job sites throughout the state. I just wanted to make sure everybody knows that I oppose this bill. We kind of rely as operating engineers. We rely on that in Wyoming. Not necessarily 26 weeks every year, every time. Sometimes you could be laid off for 2 weeks here, a week to go training, or maybe a job's only going to last 3 weeks. So it's not. I think it needs to be clear that that's not all somebody sitting on the couch for 26 weeks because they'd rather make $600 a week than, $3,500, $4,000 in a week. Some of these guys do make that type of money when they're working. They're highly skilled individuals. Everybody from excavator operators to crane operators. We build pipeline here. We work in the refineries. We work in the wind, solar, as well as building and construction. And we have to kind of prepare our apprentices and our journeymen alike to where that we have 2 seasons in Wyoming. It's construction season, and then there's winter. And yeah, that can take up a big chunk. It could be 2, 3, 4 months that these construction companies just are not doing the project because it's whether it's weather related, they're waiting until spring. I think cutting this unemployment even further would be harmful for everybody that works inside this state. It's already a struggle. Wyoming unemployed workers struggle on temporary layoffs as it is. It's used along an assistance with savings that you're able to save throughout the work season. And sometimes it's still not enough to make a house payment or a car payment toward the end when you're waiting on that call to go back to work. At that point, and we see it every year, our workers here in Wyoming are then forced to go work in other states. We have people working in Colorado right now, in Montana. And what happens sometimes is they find higher wages and it's safer and better working conditions. And a lot of them just decide not to return to Wyoming. One thing this is going to do by cutting the unemployment benefits is we're going to have a loss in our seasonal workers and a loss of a lot of our experienced workers. because they simply won't be able to, it's hard enough to survive on what we have now, but cutting it even further with the amount of work we have, I think could be detrimental. And yeah, I just highly oppose this bill, and I really hope everybody considers the ramifications of cutting assistance for so many people without. It doesn't sound like, honestly, anybody does know those ramifications, and it sounds like we're just going to have to find out. So I urge you to vote no on this bill. And thank you very much for your time.
Thank you, Mr. Cornella. Committee, any questions? Representative Yin.
Madam Chairman, thank you. Mr. Cornella, appreciate your testimony. So looking at the handout that we got from Department of Workforce Services, operating engineers is the top of the list of folks who claimed at least 20 weeks of uninsurance. And construction laborers are up there as well. Do you think that is because of the construction season versus winter season issue? Is that the reason?
Yes, sir. I believe that has a lot to do with it, and it's not going to change. It's nothing new. You know, we start our jobs in the spring and April, and a lot of times they shut down in November. If we can make it to Thanksgiving, that's a good year for us. And then, like I said, a lot of those guys either go on unemployment or they'll seek other locals where they can go to Montana or even New York or Florida. But just a lot of times they don't come back. And with the amount of work that we have coming up, it's important to try to keep those workers here right now. I think, and I never really thought about that until you brought it up, but if we were to cut that right now while we're waiting for these big job sites to start up, it could put us even in a further hole as far as being able to man these big jobs coming up.
Thank you, Mr. Cornella. Thank you for joining us this morning and for your testimony.
Yeah, thanks. Thank you for having me.
And we've got one more online. That's it. Sorry, Representative Heft, I apologize.
Madam Chairwoman, is he still on by any chance? Is Mr. Cornella still on?
Yeah, I'm still here.
Great.
We've got a question for one more question for you.
Mr.
Representative.
Yes, ma'am.
Thank you for your testimony. I'm curious, on an average year, how many weeks do you work?
Mr. Cornella.
I don't know if we have multiple job sites all over the state that have different start times and stop times. I'd say on average, if I were to just come up with a number, I'd say we probably, if we work 6 months out of the year here, that's a fairly decent year. If we get into 7 or 8 months, then that's a really good year.
Thank you.
No follow-up.
Okay, all right.
There's
Mr.
very few full-time jobs that go year-round in our industry.
All right, thank you for joining us this morning. Again, thank you for your testimony.
Yes, ma'am. Thank you.
All right, committee, we will close public comment on Senate File 175. Committee, what is your pleasure?
Move the bill.
Bill's been moved by Vice Chair Ottman, second by Representative McCann. Amendments, discussion on the bill. Representative Yin.
Madam Chairman, thank you. The renaming, I think, is a concern. I mean, I was even looking at the IRS website, trying to figure out, okay, is unemployment insurance taxable? They refer it specifically as unemployment insurance and unemployment compensation. So if we start renaming it, I think it will cause confusion. So I'm going to move to remove the renaming portion of the bill.
Okay, there has been a motion by Representative Yen to amend. Can you state the page number and the line, please, Representative Yen?
Madam Chairman, thank you. So it would be to basically just remove everything from page 2, line 16, into page 3, line 16. Oh, and on page 2, line 2 and 3 as well. And this isn't to delete it from statute, it's just to remove it from the bills because we don't need it if we're not renaming it anymore.
Mr. Caldwell, do you have that?
Just to summarize, we would be removing from this bill specifically, starting from page 2, line 16 to page 3, line 16. And then additionally, we would just, any other places in the bill that have changed the name to reemployment insurance, we'd be changing it back to the original name.
Yeah, and Madam Chairman, I think the only other place is the definition part on the top of page 2.
Okay, the motion is to stick to the name of unemployment insurance. It's been moved by Representative Yen, seconded by Vice Chair Ottman. Discussion on the amendment. Vice Chair Ottman.
Thank you, Madam Chair. I am just wondering, to delete all of that paragraph, there was created a board, does that?
Representative Yen.
Madam Chairman, it's just removing it from the bill so we don't change existing statute. It doesn't change the existing unemployment commission, which already exists. It just removes it from the bill, so we're not touching that anymore.
Committee discussion on the amendment. Representative Klauston.
Thank you, Madam Chair. Yeah, I appreciate why they were wanting to change it, but when I go online, I look up Wyoming unemployment insurance. I mean, I think there's going to be a huge cost going ahead and renaming this throughout all of our websites, all of our information, all the handouts that have been made. So in support of the amendment.
Further discussion on the amendment. Okay. Question being called by Representative Gugamas. Committee by a show of hands and a voice vote. All those in favor of Representative Yen's amendment, please state aye. Aye. All opposed? No. Okay, that amendment has passed. Committee, further amendments, further discussion on Senate File 175. Okay, seeing no further discussion or amendments, proposal question being called. Mr. Caldwell, please call the roll on Senate File 175.
This is a roll call vote for Senate File 175 as amended. Representative Klauston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft. Representative McCann.
Aye.
Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger. Representative Yen.
No.
Chairman Rodriguez-Williams. Madam Chairman, that is 7 aye, 1 no, and 1 excused.
Okay, committee, Senate File 175 has passed. Senator Kolb, do you have somebody in the House to carry your bill? Okay, great, thank you, Senator. Thank you for being with us this morning. All right, committee, moving on. I'm now placing Senate File 155 on the table for your consideration. This bill is titled International Physician Licensing, sponsored by Senator Driscoll. Good morning, Senator. Thank you for joining us this morning.
Madam Chairman, committee, thank you very much. I bring to you Senate File 155, International Physician Licensing. Folks, I'll run through this fairly quickly. Your time's kind of limited. What this is a bill that allows international physicians and surgeons to come in on a provisional license. The state of Wyoming, as we all know, it doesn't matter what town you're in. I can look at all of you. You're short of physicians and surgeons in your town. Doesn't matter what town it is in Wyoming, we're short. We've got 230,000 plus licensed doctors and physicians, surgeons around the United States that are not practicing because they can't get access to our system. And what this does is allows them a provisional license. I'll step you through the requirements, but parts of it at a high level. They've got to have practiced law for 5 years, or practiced medicine for 5 years where they're at. They have to speak English. They have to have all the necessary permits to be here legally.
i.e. green cards, whatever it takes, with medical with it. It can't just be a visa or a right to be here. Once they've done that, they cannot move into your town by themselves. They have to be invited either by a hospital or a group to come in, so they can't come in and compete in your local town without invitation. Provisional license, all the rules set by the state that come, so we get to taper it to exactly what we want and how we want it for them. Once they're here, 3 years continuous employment, either at one or multiple that they've been invited to, and the provisional license then transfers into a full medical license. Doesn't give them any residency as far as citizenship, but it does allow them to be on the same type footing. They have to meet all the same requirements and things as our doctors do, considered continuing education, et cetera. So it's just really a bill to hopefully open access. Probably not wild numbers knocking our doors down, but I can tell you, if I've got one doctor shows up in Hewlett, Wyoming, or Gillette, or Casper, or Jackson, it's a big win for us, and doesn't have a big expense. So with that, I'm going to kind of run you through. This is in 14 other states already, so this is model legislation. I'll tell you up front, this is not something that's a rocket science deal that somebody came up in the back room. It's in place in other states, 14 others, and it works. The first sections of the bills are all just definitions. It basically explains what it is, State Board of Medicine, health providers, what the requirements are to come into it. So I'm going to go through those pretty fast. We all know definitions. I'm assuming you guys read them fairly well. Page 4, we kind of start into it, the state license for healthcare provider sponsored international physicians. And this gets into it on line 12. Board shall grant a provisional license to a medical estate to enter international physicians, offer them with an offer for employment as a physician at any healthcare provider operates state. Board shall require international physician to complete an application form provided on approved by the board, pass criminal background investigation if practically available, and pay all fees themselves required by the board. So this allows the board to set anything. If they want to use international licensing, national licensing, they can add that to it. The reason the background checks have that little provision in it, some of these doctors may come from a country that's been tipped over somewhere and they don't have records available. We start thinking about some of the Middle East countries and whatnot. As long as they can provide the proof that they've doctored and they can pass our exams, we let them do it. But pretty hard to do a background check on somebody that's a refugee, and that's what some of these are. Bottom of page 4, they shall not grant a provisional license to practice medicine to any international physician unless they're able to obtain a federal immigration status allows them to practice physician. So it's not just immigration status, they got to have it to say they can be a physician. On page 5, near the top, line 5, may suspend a provisional license granted under it if is not employed by a healthcare provider that operates this state during the period. So if your local hospital or physicians group brings them in and they quit that group, the time stops. If they don't get another one, their provisional license will be revoked and taken away from them. Loses employment, healthcare, suspended until he gets employment. Line 16, they may suspend or provoke a provisional license under this section pursuant to statutes. Licenses can appeal, so if they've had it revoked, they can appeal it. That falls under the statutes. On to page 6. And this is where the meat of it comes, that it really has some change. Top of page 6, starting on line 1. Provisional license shall be eligible, it doesn't say they will be, but they're eligible to apply to convert into a full license to practice medicine in this state after 3 years of active practice under a provisional license under the statutes and subject to all rules and regulations under the Medical Practice Act and our other statutes. This is important. Once they put their time in, it says they can set up shingle in your town. So you do need to understand that once they've made the 3-year period, they're just like any other doctor in Wyoming. They can go to whatever group or hospital they wish. Middle of the page, provisional license holders shall comply with continuing medical education requirements set forth by the board's continuing medical education rules and regulations. We make these doctors, when they're provisional and afterwards, fall through everything that a physician in Wyoming has to do. We're not granting them anything that's different. Nothing in this section shall require the board to license on a provisional or full-based international physician without evidence full compliance, so they can stop them. Bottom of page 6, physicians required to obtain federal authorization for commencing any work for the sponsoring healthcare provider. Just says all their paperwork's got to be in place. They can't come in and start going and then say, we're waiting to get it. It's all got to be in place. One of the things that is different, they can actually apply for their green card from the feds for a provisional and sign the agreements prior to actually passing all through it. And that allows them to actually get here and be able to do that. Page 7, international physicians who become licensed under subsection A shall not need to maintain employment with medical. I just talked about that. Then page 7, you're back into definitions, just says what it is. Bottom of page 8 is the requirements for granting a license. This is one of the big deals. Board may grant a license to practice medicine as provided in the Interstate Medical Licensure Compact. So that puts us under the compact regulations to be able to do it. Goes through it. And then page 9 is just the annual renewal and what they have to go through to do it. Bottom of page 9 is the duties of the board, and says that the board on page 10, board retains jurisdiction over only those licenses whom provisional licenses under the deal says once are granted full, then the board no longer does it. They treat them as a regular physician. Section 3, State Board of Medicine, promulgate all the rules, says that we can go into rulemaking. State board gets to do anything they want to do within reason on it, just like the other rules. And becomes effective July 1, 2025. And the last part's the sections 3 and 4 of the act are effective immediately upon completion of all acts necessary for a bill in the Constitution. And folks, that's the entire bill. It's a good common sense bill that hopefully brings us some healthcare providers into Wyoming. I can't guarantee anything, but I pray we get a few more doctors and surgeons into the state on it. With that, I'd stand for any questions you might have.
Thank you, Senator. Senator, quick question for you. You mentioned that there are 14 other states that are doing this. Are any of them frontier states like us with physician shortages? And have you heard whether or not this similar legislation works for them with filling those gaps?
Most are. Most of them are ones that are short. And yes, there is some here. And I'm guessing there's more. Part of this is these laws got to get in place and then they've got to know they can come, because I've not seen hardly any doctors, unlike lawyers, that don't love doing medicine. Nearly every doctor you have of any kind, they spend a lot of their life learning how to do it. When they come here, I'm guessing most of them would rather practice medicine than do something else.
Great, thank you. Committee questions of the bill sponsor. Representative Klauston?
Thank you, Madam Chair. Thank you, Senator. You know, one of the goals of this committee has always been trying to increase the number of quality providers in Wyoming because of the shortage. Looking at Tennessee and Florida, they have a similar legislation. They have a 2-year instead of a 3-year, like this bill says. But they also say you have to practice under the license of a current Wyoming physician. So would you be open to that amendment that they practice under a Wyoming licensed physician?
Senator.
Madam Chairman, Representative Klauston, yes, we're open to longer, shorter windows. We went through this debate. We did not talk about under a physician, but that's much what we do with PAs in Wyoming. We've kind of loosened that up a little bit. But I think when a group of physicians or a hospital sponsors, I don't see it as a big deal for them to practice under them, because they certainly don't want somebody coming in, particularly on a provisional, that's not going to do good. So yeah, I'm very open to that.
Further questions, committee. Vice Chairman Ottman.
Thank you, Madam Chair. Good morning, Senator. I just had a question. First off, I want to say I'm glad to see this coming, because when I was on Labor Health 4 years ago, it was an issue how we were going to address this. So it's good to see. And also on page 9, it talks about a renewal fee on line 16. And I was just wondering if that'll be a standard fee, possibly that's already in effect, or if how that's going to work.
Renewal fee,
Senator.
Madam Chairman, Representative Ottman, that renewal fee, if you kind of read through it, set by the board pursuant to statute. So that fee may be higher or lower. It depends if they're trying to bring someone in, and I'm not familiar with them. We might be able to get Representative Klaus to tell us, but my guess is they might either waive that fee or make it pretty low if you're trying to bring a doctor into town. I'm not a part of it, but we've given them in this bill to really try to give our state board really wide latitude to be able to sideboard this very close, because what we don't want to do is bring someone in that either hurts Wyoming residents or is not doing quality medical care. And that's why we got to ask a lot, why the 5 years I have to practice? Well, we're not interested in doing residency for new doctors coming in. We're trying to get seasoned doctors that are good.
Additional questions? Representative McCann.
Thank you, Madam Chair. Senator, have you come across any data that shows that this type of legislation works in those other states? Because it's not necessarily a doctor shortage, at least on a whole. It's a maldistribution of doctors. They want to go where they can make money, so to speak. So I'm just wondering, have you seen any data that shows that this works in those other states?
Senator.
Madam Chairman, Representative McCann, I'm fairly positive it is working, but I think there's going to be people that testify behind me that probably have the numbers. One thing we have in Wyoming, I'll elaborate just a little. Part of these good doctors want lifestyle places and they want to be out of big cities. And I think we actually have an attraction. I happen to know up in Representative Yin's country, just south of him, they run a surgical center in a town south of him that doctors come because they can ride off skiing and fun trips up by the big park up there. And they actually treat patients at a very steep discount. They do it well. And I'm hoping some of this happens in Wyoming, frankly. Thank you.
Additional questions? Representative Yin.
Madam Chairman, thank you. Senator, so interesting bill. I think this is probably a good way to get some physicians. I like the sideboard recommended by Representative Clauston, but I'm curious on whether you or any other state has considered either a white list of countries or a black list of countries that we shouldn't accept physicians or should accept physicians from, especially for things like the background check, right? You have that background check requirement. If they come from a state where we wouldn't even be able to check if they had a criminal record, could that cause issues?
Senator.
Madam Chairman, Representative Yin, that very issue came up and we intentionally, I will tell you, chose to ignore. If they're in an area, and let's pick a tough area, let's say someone came out of Iraq or Iran, and we really don't have access to good records. Generally, as a rule, doctors aren't criminals, and they have a record, even if they have come from somewhere else, that we can find out if they did malpractice. If they've been thrown out, they've generally had a license revoked somewhere else. So, for us, we'll take the doctor, we'll let our board figure out how to do that as best they can. But the truth is, as long as they've been in good standing, they can prove that, and that part they do have to prove. Background checks, a lot of these countries don't have records on them. They just aren't there. As long as they can prove who they are and prove that they've kept their license in good standing and have actually done what they say, we chose to look the other way, and I'm going to be honest about that. I'm open to doing it, but I just do not shut out a good doctor out of one of those countries. If he's wanting to move here and he wants to practice, I'm in favor of it, I guess. Thank you.
Additional questions? Representative Wasserberger.
To kind of follow up on the previous question from Representative Yin, I actually proposed an amendment last night, and I don't think this hurts the bill in any way, but so in the amendment I had for approved, and this actually came from a credential board for medicine, but so approved countries would be, that would include Australia, Canada, Hong Kong, Ireland, Israel, Singapore, South Africa, Switzerland, and the United Kingdom and New Zealand. That was kind of the list that I got. And I think from what I understood, some of the other states that were implementing this actually had these similar countries. Are you open and okay with that, Senator Driscoll?
Senator.
Madam Chairman, Representative Wasberger, I will accept whatever your committee takes. I can tell you personally, no. I'd like to have doctors. If I can take a doctor from, as long as he speaks English, I'll take a doctor from anywhere in the world over having no doctor at all. That's my personal stance. But I respect immensely your committee, and whatever your committee chooses, that's what will get carried on the floor, and it'll get carried with pride for your side. It may be you. I'm not sure who's carrying the bill at this point, so thank you.
Thank you, Senator. Representative Clauston.
Thank you, Madam Chair, and thank you, Senator, again. There is, it's called the World Directory of Medical Schools. So there's a directory that everyone has kind of come together and said, these schools from around the world actually meet certain criteria and that are followed. So a lot of the states actually approve physicians that have graduated from one of those schools. And it's not, I mean, it will list per school, per country, if they've actually graduated from that school. So, and it includes China. Like there's maybe 15 schools from China that are on that directory. And we've got a lot of great physicians from China. So I think looking at versus maybe excluding the country, just making sure that those schools are on that list that are accepted worldwide. Would you be open to that?
Madam Chairman.
Senator.
Representative Clauston, absolutely. That sounds to me like a common sense solution, and I would hope the amendment would give the board the flexibility to waive if someone can show whatever reason. But yeah, I think we've got to have the best sideboards we can. We certainly don't want to bring in, the worst thing we can do with this is bring someone in that's bad and tank the program and cost us getting more. So no, I'd be very in favor of that approach.
Additional questions, committee, for the bill sponsor. Representative McCann.
Thank you, Madam Chair. More of a comment. My prior life in dealing with these medical professionals from other places, generally speaking, it'll be very evident very quickly whether they hold water or not. It won't take long to figure it out. Now, obviously, we don't want to ever have to figure it out, but it really won't take long on someone that maybe we can't do that background check on. So just a comment.
Further questions, comments from the committee for the bill sponsor? Okay, seeing none, Senator, thank you for
Many thanks, committee.
presenting your bill. Are there any government agencies that would like to come forward? Good morning. Please state your name and who you're with and your take on the bill.
Good morning, Madam Chairman, Representatives. Kevin Bonenblust, Executive Director of the Board of Medicine. It licenses and regulates practice of medicine by MDs, DOs, and PAs. And so the board would be the one responsible for administering this. And I want to make clear up front, as coming from an agency, we're not here to support or oppose a bill. That's not our place. It's to tell you what impacts are going to be and what the effect will be, and then perhaps give you some ideas on maybe even how to slightly improve a bill. So there were a lot of points made that I'd like to come back and answer if I can from the various members asking questions of the sponsor. And I would make a point, refer to Representative McCann's very sage observation that it's not always a shortage as it is a maldistribution. I've seen that pretty much every state, even the big one on the West Coast, has areas where there are physician shortages. So it's maldistribution, and physicians do go where the money is, where the big facilities are. That's natural. And I would also note, hearkening back to the discussion on your last bill, a lot of times the biggest problem in keeping a physician in Wyoming is having their spouse stick around after the first winter. So, that sometimes is the big decider. So just you have that. Representative Ottman asked about the renewal fee. There's actually a statute that says that licensing boards are not supposed to charge anything more than what it takes to operate their programs. We have had a boom in physician licensing to the point where we have been cutting our fees radically because we have had so many applications for licensure. We have over 6,000 docs licensed in Wyoming now. to the point where we cut application fees last year. We're now cutting our renewal fees for this coming year to the tune of anywhere from 89 to 94%. That's what the kind of numbers we had. So that tells you that we're not going to be setting an outrageously high fee because we're limited by statute. And we're already sitting on money we have to give back to our licensees. So that's a piece of good news from our story. As far as, with all due respect to the sponsor, there are doctors who are criminals. And you might recall that there was bombings of buses in London, and there were physicians involved in that. This past Christmas, there was a terrorist attack of driving a car through a Christmas market in Germany. That was a doctor. So we can't assume that the licensing laws exist not because of the good people, because of the bad people, is really why they're there. So it's not to disagree with the honorable sponsor, but just we do get them. And occasionally you'll see the headlines where we've got a doctor in Wyoming that we have to deal with. I like Representative Clausen's note about the International Directory of Medical Schools. There is a very robust program out there right now. It's called the Education Council for Foreign Medical Graduates. And they maintain a list as well. They vet schools so that they know that the person who's coming in has gone through a legitimate program, has legitimate training, et cetera, et cetera. And that's what we would propose. Oh, they also verify fluency in English, which is obviously part of this bill and important. So with our board, we already require that for international medical graduates. I can't see why we wouldn't do that for these applicants as well. And so that might address some of those iffy questions. Coming back to the criminal history, I would say that if you go to the bill as engrossed, page 4, starting on line 17, line 17, the applicant must pass a criminal background investigation if practically available. Now, first off, that if practically available, it sort of makes me nervous because, okay, if it's a country where we can't figure it out, we can't get communication with that country, say Iran. Do we really want to waive that completely? We're going to have to figure out how to do international criminal background checks, but we will figure out how to do it. But I would caution that if practically available, it makes it sort of a non-requirement. And I think that's very scary for people in Wyoming, just not knowing. Anyway, with that, Madam Chairman, I sent to the committee members 2 suggested amendments. One, and I'm going to take them out of order for what I numbered them. I'm going to take my number 2 first. And that is, we would like to have an appropriation. It's going to cost us money to set this up in our systems. It's going to have to, to do our online forms, et cetera, et cetera. What I've drafted here is an appropriation that would be, the bulk of it would be a one-time, be $40,000 to upgrade our systems, and then a small amount that could be folded into our ongoing budget requests for about $7,000 for operations. This is not general fund money. This is special revenue funds, some of those funds that we've been collecting from all the applicants for licensure. And so it's either this or we would do a B11, practically speaking, and sort of, I just feel better about having an appropriation than I do about having a B11. One way or another, we'll need to do that to implement this, to have the online forms, et cetera. The other one is, what I number 1, would be to go to page 5, line 5, and reinsert language that was originally in the bill that said that the board shall not grant a provisional license to practice medicine in the state to any international physician unless they possess a passing score on the USMLE. That's United States Medical Licensing Examination. Every single doctor that gets licensed in Wyoming has to pass that test or the equivalent for DOs, which is, they call it COMLEX, but same thing, different name. These would be the only physicians in Wyoming who would not have to demonstrate that they could pass the US licensing exam. I understand that this was pulled out on the Senate side. The sponsor of the bill offered the amendment. I would really urge you to put this language back in, with no offense to the sponsor. But these would be the only doctors in the state who haven't passed that exam. And lest you think that there are doctors that would not have a problem with this. We used to have a problem. We didn't have a limit on how many times you could take the USMLE. Now we have a rule that says you have to pass it, all three parts, within 7 attempts, which research has shown that really helps make sure you're getting quality physicians, because past 7 attempts, you've got lower quality and you've got higher chance of running into problems with the board. The one that finally tipped my board over on the story was when we had an applicant come in who was in the US, didn't have a US license, had graduated elsewhere, had a license in another country, and he had taken the test 27 times to be able to pass it. Now, I don't know how you feel about that, but I'm not sure I'd want to be sending my kids to a doctor that took 27 attempts to get something right. You know, it'd be one thing, maybe a couple attempts to get the right diagnosis, 27 attempts, you know. So all I would say is I would strongly urge you to put this back in. And of those other states that have run this bill, I don't believe any of the rest of them have pulled that out. We don't want to make it look like Wyoming's the easy way in. We want to at least make sure that we're doing it seriously, because if you make it the easy way in, that's when you're going to start having problem candidates come through. So I would urge you to reinsert that language. And again, with no disrespect meant to the sponsor, but I just think it needs to be in there. So with that, Madam Chairman, I've prattled on, but there were a lot of issues I wanted to touch on. If there's any questions I can answer, I'll happily do it.
Thank you. Committee, any questions of the department? Representative Gugemas.
Thank you, Madam Chair. Do you know why that language was taken out on the Senate side? Did they give a reasoning for that?
Madam Chairman, Representative Guggenmoss, I'm always really careful to talk about why somebody did something, but I know that they had testimony from the national organization that had put together this bill, and it was kind of thrown out there, well, you know, if you want to change it, if you want to take out the testing requirement, and I think that planted the seed. I don't know that any other state is doing that. The model bill has the testing requirement, and so I would urge that it be put back in.
Further questions, committee? Representative Wasserberger.
Thank you, Madam Chair. Okay, so I was hearing you make a comment or concern about the about doing a international background check. So with the amendment that I have here, I was mentioning it to our sponsor of the bill. But would this help with that concern of the international background checks for that list I included, which would be Australia, Canada, Hong Kong, Ireland, Israel, Singapore, South Africa, Switzerland, United Kingdom, and New Zealand? Would that help with that concern with that? Or would it be better to just go the way that King Clausen's route is with the board of directors of medicine that are recognized throughout the world?
Director.
Madam Chairman, Representative Wasserberger, I think that the approach you've suggested would probably be the cleanest, because we have working relationships with those countries. We have that. I appreciate what the sponsor wants to do, though, and wants to be able to get doctors from other countries. And I think the suggestion for Representative Clouston would get us there. I think the ECFMG will also help us get there with how they vet the degrees in the schools. So I think any one of those will do it. Just like I said, I get very nervous with that language of if practicably available, because that's sort of like a big asterisk. You got to do a criminal background check unless we can't do one on you. And that just doesn't seem safe or smart. So I hope I answered your question.
Further questions, committee? Representative Clouston.
Thank you, Madam Chair, and thank you again for being with us. Instead of an appropriation, if we have, I think the appropriation you put in was like $48,000. If we have 6,000 licensed physicians, right, we're talking $8 per license, and we've been decreasing those. So as this would be part of the cost of the board, would we be better served just to add $8 or $10 to the licensing fee to make up for that?
Director.
Madam Chairman, Representative Clouston, if you add anything to the license fee, first off, the board has the authority to set the fees, and so it's supposed to stay within its requirements. But separate from that is that we've got funds. These funds are, we're giving funds back to our licensees by cutting fees up to 94%. But we can't spend a dime without the blessing of this body. So, even though we're sitting on a reserve, we can't spend any of that without an appropriation or a B11. We're just not allowed to. So it doesn't matter if we raise these fees to $1,000 each, we can't do that. So that's the reason why it's either an appropriation or a B11 because this is a new add-on and we're already within our budget. And so this would just need to take this into account.
Additional questions? Follow-up, Representative Klauston.
Thank you, Madam Chair. So again, I'm looking at page 3, line 3, a medical program of good standing, and then adding either the World Directory of Medical Schools, or you'd suggested another kind of accreditation vetting. Could you give us the name of that again?
Certainly, Madam Chairman.
Director.
Representative Clausen, it's the Educational Commission on Foreign Medical Graduates. And the board already has that requirement in rule. So they use that for international medical graduates coming through the normal pipelines. So I would anticipate that we would go ahead and to, square this up with that. In the rulemaking, the board would say, we'll do the ECFMG because that's sort of the gold standard. So I think the rulemaking would take care of that.
Committee, I just want to draw your attention to the time. Any further questions of the department? Board of Medicine, excuse me.
Close enough.
Okay, seeing none, thank you, sir, for joining us this morning.
Thank you all very much.
All right, seeing no other government agencies, public comment, please come forward. Registered lobbyists. Let's fill these chairs. Folks, I'm just going to ask you to keep your comments succinct. And if the person in front of you stole your thunder, just offer something else to the bill, okay? Thank you. Good morning. Please state your name, who you're with, and your take on the bill.
Thank you, Madam Chairman. My name is Tyler Lindholm. I'm the State Director for Americans for Prosperity here in the state of Wyoming. We're on and in favor of this legislation, and I wanted to provide some clarification as to why the Senate pulled out the exam requirements. My doctor is a international medical graduate up in little old Sundance, Wyoming. He graduated from Australia. He was born and raised in Wyoming. It was cheaper and a better opportunity for him to get his degree in Australia, so that's the direction that he went. That requirement for the exam, it was my doctor that mentioned, hey, this is actually going to be a barrier. You're going to have some doctors with 20 years of experience that look at this as a barrier to entry and really aren't going to be too excited about taking just a standardized exam just to continue their practice. This piece of legislation does provide full rulemaking authority for the board, so that provides them the opportunity to dig in farther if they do need to verify those credentials. And with that, Madam Chairman, I'll stand for any questions.
Thank you. Any questions of Mr. Lindholm? Representative Yin.
Madam Chairman, and maybe I should have asked this to Mr. Bonham-Bless, but I'll ask this to you, Mr. Lindholm. So when they convert from a temp, if we leave this language out without the test, if they convert from a provisional to a full license, would they still have to take the test before they convert to a full license?
Mr. Lindholm.
Madam Chairman, and to Representative Yin's question, no, they would not have to convert. To my understanding, I'll let him correct me if I'm incorrect in that regard, but no, they've already been practicing within 3 years, we would assume in good standing, and so they'd be ready for full licensure at that time.
Any additional questions, committee? Okay, see none. Thank you for joining us this morning. Sir, please state your name, who you're with, and your take on the bill.
Good morning, Madam Chair. My name is Jeff Doherty. I'm here today on behalf of Cicero Action, speaking on and in support of the bill. Most of my comments have already been made by previous speakers, so I'll simply give you this one example that is out of Idaho. There's a physician that's practicing there who was the Brazilian soccer team doctor, could not get a job in the United States until Idaho adopted this into their statutes, and now he's able to perform orthoscopic work up there. And it's very successful. To some of the questions that have been raised so far, is this working? According to my clients, they say that in Tennessee, there are 6 doctors who have become provisionally licensed under this, 3 in Idaho, no open investigations so far. But I would also note that most other states' laws are just now becoming effective. There is also, to my client's knowledge, no blacklist, no whitelist, but Arizona does have a bill with a whitelist in it. That's not adopted into law right now. And Madam Chair, in the interest of time, I'm going to stop there.
Thank you. Committee, any questions? Mr. Daugherty? Okay, see none. Thank you for joining us this morning. Sir, please state your name, who you're with, and your take on this bill.
Madam Chairwoman Rennie McKay, President of the Wyoming Business Alliance, just want to say real quickly how important it is to the business community to have access to healthcare in Wyoming. So we are in support of this bill and appreciate one more attempt to try to find an ability to get more doctors into Wyoming. Representative Clausen, I appreciated your concept because this is a small state with small communities. So I think if you have a connection to a local practicing physician, then that offers some, I think, reassurance to the rest of the community that while you've got someone coming in, you've got someone who's going to be specifically keep working with them really closely to make sure that they're providing good care and helping them adjust into the community too. So I thought that was a great amendment. And with that, I'll stand for questions.
Any questions, committee? Mr. McKay? Nope. Thank you for joining us this morning. Any further public testimony on the bill? Anybody online, Mr. Caldwell? Okay, seeing none, committee, what is your pleasure? The bill has been moved by Representative Gugemas. Second by Representative Hoft. Committee, a discussion and amendments. We have 3 handouts of proposed amendments, I believe, total, for the committee's consideration. Representative Wasserberger.
Thank you, Madam Chair. I think I'd like to just move the amendment that I have here on the list of countries that they approve, so it's more consistent with Arizona's law. And so, yeah, I'd like to make a motion to move the amendment.
Second.
Okay, we have an amendment that's been moved by Representative Wasserberger, second by Representative Yin. Mr. Caldwell, you have a copy of that, correct? Great. Discussion on the amendment.
Madam Chairman.
Representative Yin.
I wonder if it would be friendly to the bringer if we could add to that list of countries, Taiwan, South Korea, and Japan.
Representative Wasserberger.
I have no issue with that. That's a friendly amendment.
Okay, so there has been a change to the amendment. Mr. Caldwell, do you have those countries? Okay. Discussion on the amendment. Representative Clausen.
Madam Chair, I just think this is a little bit too limiting. I've worked with great physicians that are from France, from Central America, from South America. I can tell you my son had some major medical issues, and the doctor that was from Peru is the one that solved his issue. So again, I appreciate where this is coming from, but I think it's a little bit too limiting on the number of providers that we're going to open it up to. Thank you.
Further discussion on the amendment? Representative Wasserberger.
I don't disagree with what you have to, with what Representative Clausen has to say about that. My thoughts are is just to keep it kind of consistent, have it with the countries that we know we have good relations with. And so that's kind of, and I mean, and as far as, knowing other countries, I know when I go to Nigeria, their medicine is probably the cheapest and best medicine I've ever used. But just so we're able to keep in good standing with countries that we know we have consistent relationships with, just to be a little more consistent with some of the states that have already got a law in place. That's why I just thought it would make sense to have this amendment.
Further discussion on the amendment? Okay, seeing none, sensing the urge to vote on Representative Wasserberger's amendment to add friendly countries. By a show of hands and a voice vote, all those in favor of Representative Wasserberger's amendment, please state aye. Please state aye.
Aye.
All opposed?
No.
Okay, that amendment has failed. Committee, additional motions on amendments or discussion on the bill? Representative McKeon. Oh. No. Okay. Further amendments. Representative Clausen.
Thank you, Madam Chair. Ladies and gentlemen, on page 4, line 20, after provisional license, I would like to add and practice under the direct supervision of a physician currently licensed in Wyoming.
Is there a second? Okay, we have an amendment moved by Representative Clausen, second by Representative Yin. Mr. Caldwell, do you need clarification?
Madam Chairman, just to confirm, that would be after, on page 4, line 20, after license, inserting a new sentence that reads, in practice, under the direct supervision of a physician currently licensed in Wyoming?
Correct.
Discussion on the amendment. Representative McCann.
Thank you, Madam Chair. I like that idea, but I'd like to put a sunset on it. I mean, I think once they prove themselves within 3 years would be sufficient, depending on the subspecialty or the like. I just would suggest that. I don't think they should be under it for a lifetime. If they prove themselves, they should be good.
Representative Clausen, is that a friendly amendment? Discussion?
Discussion, thank you, Madam Chair. I'm going to bring on page 6, it says the provisional license. It says 3 years in here. I'm going to change that to 2. You know, I think some of these physicians are bringing these people in who, 3 years is a long time. So I'll bring another amendment there to change that to 2 years.
Okay, still back on the amendment, moved by Representative Clausen. Further discussion on the amendment. Seeing none, question being called by Representative Yen. By a show of hands and a voice vote, all those in favor of Representative Clausen's amendment, please state aye. Aye. All opposed? Okay, that amendment has passed. Further amendments. Representative Clausen.
Thank you, Madam Chair. Committee page 6, line 3. It says after 3 years, so 3 is spelled out, and then the number 3. I'd like to change that to 2 in both of those instances.
Is there a second? Okay, we have a motion to change it by Representative Clausen, seconded by Representative Guggemos to drop it down to 2 years, page 6, line 3. Mr. Caldwell, do you have that? Great. Discussion on the amendment. Okay, seeing none, question being called. All those in favor of Representative Clausen's amendment by a show of hands and a voice vote, please state aye. Aye. All opposed? Okay, that amendment has passed. Further amendments, committee, Representative Yin.
Madam Chairman, thank you. So in this same section, we're talking about converting the provisional license to a full license to practice medicine. What I want to make sure is that when someone gets a full license, they are under the same requirements, right? So full licensure for any other doctor requires the licensing exam passing score. And so on page 6, line 8, I'd like to add and, at the end of the 601, add and possess a passing score on the USMLE as provided in the statutory reference that we have in the Board of Medicine portion. So this wouldn't require them, well, I'll wait for a second before I keep talking.
Is there a second? Okay,
So
amendment's been moved by Representative Yen, second by Representative McCann. Mr. Caldwell, do you have okay, he has the amendment. Discussion, go ahead, Representative Yen.
Yeah, Madam Chairman, so that's just to make sure that all doctors who have the full license have taken the test, so there wouldn't be any doctor that doesn't have the full license. I'm unconcerned about the provisional license because we put the guardrail that Representative Clausen has in place, but I do think that we shouldn't have doctors that have differential rules under them, right? So we make sure that everyone has passed the exam.
Discussion on the amendment. You see none, question being called by a voice vote and a show of hands. All those in favor of Representative Yin's amendment, please state aye. Aye. All opposed? Okay, that amendment has passed. Committee, further amendments. Representative Heft.
Thank you, Madam Chairwoman. On page 4, if we look at line 18, after the word investigation, comma, strike if and practically. And on line 19, strike available.
Okay, did you move that?
What's that?
Did you move that?
Oh,
Did you make that motion?
I move.
Is there a second? Okay, there is an amendment by Representative Haft, seconded by Representative Gugamas, page 4, lines 18 and 19 to strike practically available. I've had too much coffee. Mr. Caldwell, do you have that?
Yes, Madam Chair.
Thank you. Okay, committee discussion on the amendment. Seeing none, and the question being called by Representative Gugamas. By a show of hands and a voice vote, all those in favor of Representative Heft's amendment, please state aye. Aye. All opposed? Okay, that amendment has passed. Committee, further amendments? Further discussion on the bill? Further amendments? Representative Klauston.
We have two amendments in front of us that were suggested, so I'm gonna move the first one. Page 5, line 5, we all have the language in front of us. Is that taken care of? I guess I'll move it first, and then I guess we'll discuss it.
Second for discussion.
Okay, Representative Klauston has moved the amendment. Amendment number 1, provided by the Board of Medicine, to, on page 5, line 5, insert, shall not grant a provisional license to practice medicine in the state to any international physician unless they possess a passing score on the USMLE as provided in Wyoming statute. And it's been seconded by Representative Yin. Discussion on the amendment, committee.
Madam Chair?
Representative Klauston.
Thank you, Madam Chair. So I guess my question there is with the amendment that Representative Yin had proposed earlier, do we still need this amendment, or had we already taken care of that?
Discussion, committee, or if the proposer of the amendment would like to briefly answer that, we would consider a yes or no to the bringer of the amendment's question.
Madam Chairman, to be brief, this language that we proposed would be to get the provisional license. What Representative Yin's amendment says is to then convert from a conditional license to the permanent, you'd have to have the test score. So it's two different spots in the process, before and after the conditional license.
Thank you. Committee, further discussion on the amendment? Representative Yin.
Madam Chairman, I think I'm satisfied with the physician oversight to make sure that they're doing all right. I don't know how hard it or how easy it is to take the test, but if someone can take it 26 times, it can't be that expensive. But I just wanted to make sure that as long as they were, when they were getting the full licensure, it was an issue. But when they're getting a provisional license, I mean, I think that's a policy discussion that's up to the committee.
Committee, Representative McCann.
Thank you, Madam Chair. I actually like the way we have it now, because they can still work provisionally. It also gives them time to study for the test.
Further discussion? Okay, seeing none. By a voice vote and a show of hands, all those in favor of Representative Klauston's amendment, please state aye. Aye. All opposed? No. Okay, that amendment has failed. Further amendments?
Madam Chairman,
Representative Yin.
I'm not going to move the other amendment. I think that we should actually save that one for the floor, because what I don't want to do is get this re-referred to appropriations, because we are on Wednesday of the last week of committee meetings. So I'm happy to bring it on the floor with anyone else. I think it is our job to do the appropriation rather than have them be 11 which they are going to do if we don't do it anyways. But I don't think that we should do it in committee right now.
Committee discussion on the bill? Further discussion? Okay, seeing none, question being called by Representative Gugamas. Mr. Caldwell, would you call the roll on Senate File 155?
This is a roll call vote on Senate File 155 as amended. Representative Clouston.
Aye.
Representative Gugamas.
Aye.
Representative Heft. Representative McCann. Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger. Representative Yen.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 8 aye and 1 excused.
Okay, committee, Senate File 155 has passed committee. Senator Driscoll is no longer with us, but if somebody, we'll have to reach out to find out who's going to carry that bill.
Madam Chair. I had a conversation with him this morning.
Okay.
I told him.
So Senator Representative Wasserberger will carry the bill. Committee, just a couple of things that I wanted to inform you. Thank you, members of the public, for joining us this morning. Committee, next Monday, our committee will meet with the Senate Labor and Health Committee for joint interim topics. That meeting is scheduled Monday, March 3rd at 12:30. And then also our committee is going to host 2 hearings per the request of our good speaker. We'll host one this Friday morning at 8 a.m. and then another one next Wednesday at 8 a.m. Those meetings will be noticed on the website. And then this afternoon, I will forward committee members the Department of Health's Health Stat 2024 report for your review as well. So it's kind of a big document, but I invite you to read it. And if you have any questions, I'll ask that you just forward me the questions, and I'll combine them from the committee and submit them to the Department of Health Director. Okay, so the meeting is adjourned.